Go live, Chair Medina.
Thank you, Denise. Good morning. We have a quorum of members present this morning, and the New York City Board of Correction May 10th, 2022 meeting is now in session. Our first order of business is to vote on the draft minutes for the March 8th board meeting, which board members have received. Will a board member move to vote to approve the March 8th, 2022 minutes? Jackie, I see you. Jackie, I see you. Will a board member second that motion? I guess it was second. Second. Does any member have any edits or comments on the minutes? No. I now call for a vote to approve the February 8th, 2022 minutes. The minutes are approved. Okay. Board of Correction is pleased to introduce two new board members, Jacqueline Pitts and Joseph Ramos. Jacqueline Pitts is a passionate public servant, accomplished anthropologist and teacher, and published author. Ms. Pitts gained valuable leadership experience during her 18 years at New York City Department of Corrections. She served in roles that included correction officer, training captain, assistant deputy warden, facility tour commander, and commanding officer, to name a few. Her appointment to the New York City Board of Corrections aligns with Ms. Pitts' passion for community safety and correctional oversight. We are very glad to have her on board. Ms. Pitts, do you wish to introduce yourself? Have any comments?
Yes. Good morning, Commissioner Molino, DOC staff, CHS staff, fellow board members, and stakeholders. I am honored to have been chosen to serve on the Board of Correction. I believe my past participation in correction, beginning as a correction officer in 1979, retiring as an assistant deputy warden, and current involvement as a Board of Correction member is my calling. To state the obvious, these are tremendously challenging times for the department. But where there are tremendous challenges, there are usually great opportunities to do the new and unimagined. As we know, turning challenges into opportunities is not easy and will not be easy. However, I am excited to be part of the process that will hopefully bring about positive change for both detainees and staff. In closing, I'd like to take this opportunity to say to Commissioner Molina that your reputation preceded you. And when I learned you were appointed commissioner of the New York City Department of Correction, I was pleased and felt encouraged. I look forward to working with you and your staff. Thank you.
Thank you, Ms. Pitts. Our second recent member is Joseph Ramos. He is an esteemed public servant with over 60 years of experience serving in New York City. Mr. Ramos has dedicated most of his career to New York City Department of Corrections, New York City Police Department, Bronx Borough President's Office, and the New York City Housing Authority. Mr. Ramos enacted policies that increase diversity, equity, inclusion, and accessibility within city government and community organizations. Mr. Ramos' appointment to BOC aligns with his deep and long commitment to public service and New Yorkers. Thank you, Mr. Ramos.
Thank you.
I'll turn it over to you, Amanda.
Good morning. Now we're going to turn to some census data. On May 9th, there were 5,494 people in jail compared to a 6,454 peak census on September 14th of 2021. As of May 6th, 2,632 people in custody were Brad H class members, meaning they had a number of contacts with mental health services. And that's approximately 49% of the total population held, Brad H. On May 8th, CHS reported a total of 780 people in jail had recovered from COVID-19. I believe 28 of these individuals had an active infection. The people who were in jail at the beginning of this month included 4,964 people in pretrial detention, 356 people serving a city sentence, 14 people held on technical parole violations with no open case, 480 people in custody for other reasons, for example, state sentenced or state ready. Last Saturday, we had the 4th death in custody for 2022. Desean Carter was 25 years old. He died on Saturday evening. He passed away in a general population area, and although the cause of death has not yet been reported, the death appears to involve the use of a ligature around his neck. Desean Carter had been transferred to Rikers from a psychiatric hospital 2 days before his death. He is survived by at least 2 siblings, and we express deep sympathy and very sorry for their loss. And the Board of Correction investigation commenced on Saturday. We know there's been a lot in the news that's dark, and the news of these tragedies can hit hard. And so we wanted to add for the public that if you are experiencing a mental health crisis, stress, depression, anxiety, or drug and alcohol abuse, and you live in New York City, you can call 1-888-NYC WELL, WELL, for free and confidential crisis counseling and other mental health resources. Next, the board expresses condolences for the deaths of department staff since our last public meeting. And there are many. The DOC deaths since March 9th of 2022 include CO Coletti Saviero, also the mother of Joyce Panasic, retired Captain Gregory Drake, retired CO Frank Cotton, ADW Junior Patterson, retired CO Antonio Valentin, retired CO Ronald Friscotti, retired CO Deborah Halsey, retired CO John Hughes, retired Captain Dimas Saliberios, Achin Chu, the brother of Christopher Chu, retired Captain Willie Eady, retired CO Maurice Livingston, retired CO Faustio Ruffini, retired CO Marilyn Nelson. We also thank COPA Representative Ashaki Antoine for her participation in the board's public comment periods and her consistent engagement with our staff. This has been a very busy time for all of us, but we look forward to meeting with you soon. And we also want to underscore some recent examples of cooperation between the department and the Board of Correction in 2 instances where unsafe conditions in the housing areas, bathrooms and showers for sick people and people in mental observation were explained by the BOC staff on behalf of people in custody to DOC, and DOC moved quickly to rehouse the men in safer conditions. And it's an example of, I think, the importance of our staff out in the jails being present and able to problem solve and work cooperatively with CHS and DOC to help people on the spot. And we appreciate them, and we need more of them. And I'm turning over to Julio.
Thank you, Amanda. So just let me frame some of the narrative as we go forward. You know, as we know frames, I think this is important for me and hopefully for all of us, because as we all know, this isn't a finger pointing expedition. This is kind of how do we continue to work collaboratively to make sure not another life is lost, to make sure we can cut down and reduce some of the violence. And I think this happens with all of us kind of cooperating and working together. So I just want to talk about how we frame this conversation and how that becomes the organizing principle, right? And how we socially share and are persistent over time, some of these principles and some of these narratives. In the case of framing this narrative, it's all been about Rikers, right? And for years, right, decades, we've seen this narrative always focus on, the inhumane conditions, on deaths, on stabbings, and sometimes the overall chaos both correction officers and the people inside must endure. Yet, right, within this cloud of controversy, 5 months ago, with all this at hand on the midst of COVID, Commissioner Molina stepped in with the courage and the belief to change this, and we know that the department has been in crisis for some time. Your commitment and passion, and Commissioner Molina, for reform, knowing you prior to becoming commissioner, and the work that you've done is a testament to the change I know you are looking to make on the island. We as BOC appreciate the efforts in improving programming, building staff capacity, strong partnerships with faith-based organizations, community leaders, nonprofits, all trying to figure out how do we change the narrative that's taking place on the island. I know when you first arrived, you pointed out the problems with RMAS, and that was all the stuff was kind of already in the works. That you saw units being built in NYC with a plexiglass room attached to cells to serve as a day room. You realize we're just not in keeping with the spirit of RMAS, so you changed that, which again just talks to your commitment to this. So we appreciate that. I want you to know, committed to building RMS units that have large community day rooms, that people in custody can spend time and mitigate the bad effects of isolation. That's important. We understand that. So we appreciate your commitment to RMAS and finding humane ways to deal with security concerns. And we know everything depends on staff, right? Staff returning, people getting back to work. And we just want you to know, in the spirit of transparency and open communication, we're here to help support any changes that you're looking to make. With that, I want to introduce Commissioner Molina.
Good morning, members of the board. Before I begin, I would like to welcome the board's two newest members, Ms. Jacqueline Pitts and Mr. Joseph Ramos. It's heartening to see more people of color appointed to this body, which provides oversight for an agency whose workforce and incarcerated population is predominantly Black and brown. I'm confident that your experiences and expertise in correctional settings will prove invaluable to the Board of Correction, and I look forward to working with you both. I also just want to say that we recently did have an active Assistant Deputy Warden, James Sims, pass away. So we'll be attending his services this week, and I just wanted to add his name to the list of those, and condolences to the family that was remarked by the Board of Correction. So thank you for that, and for keeping our department in your prayers and thoughts. I want to start by also acknowledging a recent death in custody. Mr. Desean Carter passed away over the weekend at the age of 25. I'm heartbroken for his family and loved ones, and my deepest condolences go out to them. In the 4 short months I have been commissioner of this agency, 4 individuals have died in our city jails. This troubles me profoundly. When an individual dies in a New York City jail, it's a failure of the whole system. The board rightly points out in their report regarding the deaths of Mr. Youngblood, Mr. Pagan, and Mr. Diaz, that many of the issues facing this agency are longstanding, some decades in the making. It was clear to me as I stepped into this role that the exact same foundational issues persist today as when I was the department's chief internal monitor in 2016 and 2017. Then what I saw was deeply flawed security practices, inadequate supervision at every level, an ineffective utilization of staff, and an absolute lack of accountability. I documented these issues in a report published in December of 2016 and noted that if they were not addressed, things would likely and predictably worsen. Rather than face the facts of what existed then in 2016 and 17, and seriously considering what was proposed, this department went on to further ignore correctional best practices and policies, which produce poor outcomes year over year. Instead of addressing these issues head on, this city has systemically disinvested in its jail system. It historically ignored the crumbling infrastructure in our jail facilities and expected them to remain intact and safely house the incarcerated population, while at the same time disregarded the needs of staff, yet expected the members of our staff to remain fit for duty and engage in their work. The ineffective decisions of prior leaders of this city and this agency have crippled the department's ability to effectively operate, and it has resulted in tragedies for officers and people in custody alike. In recent months, critics have stated that willpower is not enough to turn this department around and have called for a change in leadership in the form of a receiver. Fundamentally, these critics and I have been saying the same thing. And what I've constantly said is that leadership matters. The difference between today and 2016, when I first pointed out the deep flaws of this agency and a viable pathway to recovery, is that I am now the commissioner of this agency. I intend to exercise my power as commissioner to the fullest to address the ongoing issues in this agency. I recognize that saving this department is not just a matter of will, it is a matter of action. I think it is important for you and the public to understand that my words have not been hollow, that I am committed to reform and have already demonstrated tangible steps forward towards that end. I want to be clear as it relates to the monitor's report and recommendations, and as it relates to his recommendations, I intend to adopt them in short order. An implementation plan, which will detail processes and timelines, is currently under discussion with the monitor and will be filed with the court just 1 week from today. In just 4 months, actions my team and I have taken have resulted in a decrease of several major violence indicators. Calendar year-to-date, assaults on uniformed staff have decreased 27%. Assaults on non-uniformed staff have decreased 33%. And calendar year-to-date use of force incidents have decreased 27%. I recognize the frequency of these assaults and use of force incidents are still high, but these trends are moving in the right direction, and my goal is to sustain this downward trend. At the end of February, not even 2 months into my tenure, I instituted a strategic violence reduction plan at the Robert N. Daverin Center to address the heightened levels of violence at that facility. This plan outlined changes to housing policies, improvement to staff supervision, and enhanced programming and services to provide critical opportunities for behavioral change and growth for emerging adults. This plan ended the misguided practice of concentrating gang affiliations in housing areas at RNDC, a strategy that has since been rolled out at other facilities. We have also strategically increased facility searches and tactical search operations at RNDC, a practice that was largely abandoned during the pandemic. These searches have resulted in the recovery of 700 weapons from RNDC alone and 2,300 across all facilities. Since we've instituted this strategic violence reduction plan, slashings and stabbings at RNDC have decreased by 45% in April compared to March of this year. And department-wide, we saw a decrease of 35% in slashing and stabbings. And when you compare April 2022 to April 2021 at RNDC, we saw a 25% decrease in slashings and stabbings. This success is the result of intense focus on areas prone to higher violence and precise action. I recognize that implementing best practices and sustaining these trends cannot exist without a timely and meaningful discipline process, which has been largely absent from this department. I have closed out and administered in my time in office final disciplinary dispositions in over 725 disciplinary cases, not only holding staff accountable, but at the same time allowing them to move forward with their careers and not being held in limbo because of a disciplinary case that was not finalized. As you can see, I am committed to reform and making the tough decisions that are necessary to move this agency forward. I agree with the board's assessment in their recently published report on deaths in DOC custody, that I have inherited a broken and dysfunctional system which has been in place for several years prior to the start of my tenure. The board also stated in the report that you wish to work in partnership with me and my team. I have always welcomed this opportunity and look forward to gaining additional perspectives from the new board members. I come before you each month and spoken honestly about the failings of this agency. Make no mistake, the whole city has played a part in this failure. All of us must now collectively as a city reflect on our part and work to move this agency forward. I appreciate as always, the opportunity to share what I have accomplished in a testimony over the past 4 months in service not only to this agency, but in service to the city as a whole. My team and I are available to answer your questions.
Thank you. Thank you, Commissioner. Any questions from the BOC members? All right, so I got a question. Real quickly, have we thought, and I know you're going to release this plan, Commissioner, you talked about, in another week or so. Is part of that plan releasing anyone? As you know, those COVID numbers at one point, we were down to 3,900 from 5,300. And once COVID hit, we were able to release 1,400 people. And in that release, of course, crime didn't go up, if you remember all that. Is that part of the plan? Can you share that with us?
So you're referencing, I would say, really within my powers, the 6A plan, if I'm understanding you correctly, sir.
Yeah.
And what I had committed to early on was really reevaluating our assessment regarding how we do 6A. That is underway. While that's not going to be directly related to the implementation plan, DC Torres' team and I have been working, and soon we're gonna, we think, have a new way forward that we can share with you on how we're evaluating 6A and that process.
Thank you. Any other?
Yeah, well, just on that point, Commissioner, I appreciate that you'll engage with 6A, but I hope the police department goes along with you on that. The census has grown among city citizens from 120 in January to 360 on April 1st. So it's a long way to go. Thank you.
Thank you, Bobby.
Thank you. I want to just follow up on the topic of population, understanding that 6A, the city sentence individuals, is the area where the commissioner has direct authority. There are also other things that the department can do, I think, as being a partner with other actors, district attorneys, city hall, in looking at other aspects of the population. And if you look in particular at people who've been in custody for over a year, which is something that the monitor did flag in a letter to the court last month, we've seen that population go up significantly. According to some numbers I've seen, it's almost double the percentage of the population in terms of makeup today than before the pandemic, with hundreds more people who've been in for 3 years or more who have been at Rikers. So going back even before the pandemic started, there are people who've been in for that long, significantly more as a portion of the population than before the pandemic. I think over 300 as the last number I've seen, and over 400 people who've been in for over 2 years. What efforts is the department making to work with all of those other stakeholders to ensure that these cases are prioritized, not only so that the cases can be resolved and there's finality, but also as a part of the population, a way to address conditions in the jail. If you add all of these up, it does add up to more people than the city sentences, so the impact would be quite profound. So what efforts, whether it's coordination or working with other colleagues in government, are underway?
For your question. So I think first I would say that we did have challenges early on, starting in January at the tail end of getting through the last surge, Omicron surge, with court production. And what I would tell you is that court production has significantly improved since then. And that's one part of making sure that we have a functioning, robust court system. As far as coordination, I have had meetings and discussions with OCA as it relates to the federal monitor's classification consultant regarding those that have been in our custody for very long terms and the progression of their cases. I'm working with the director of the Mayor's Office of Criminal Justice to work on how we can better address population management as it relates to that population and how we can move those individuals' cases forward, whether they're primarily in one jurisdiction, some may be in multiple, but that is something that I'm working on with Mock J.
And just one follow-up question. Within the department structurally, what division or kind of department or office is this housed under? It just would be helpful to know kind of where it's situated. You know, is it under custody management, general counsel's office? Who's the point on making sure that these efforts are pursued rigorously so that these higher priority cases are addressed?
So I think one is we have the court production managed directly by an acting assistant chief to make sure that individuals are properly produced. As it relates to who's leading this work on our end, right now that work is between myself directly and the director, because we want to make sure we have a framework in place and how we're going to move forward. And then it's likely that the lead of that at the uniform side will be in the classification and custody management level. But I want to make sure that that framework is properly in place between myself, the director of Mock J, as she represents our interests with the other district attorney's offices.
Okay, thank you. We look forward to hearing how that framework ends up being developed and who is in charge of implementation.
Thank you for you. Felipe.
Hi, Commissioner Molina. Thanks for your testimony and opening remarks. Can you talk a little bit more about, which I believe the recent increase in attendance to school, particularly in RNDC, and how's it going with your new policy of making sure that gangs are not congregated in housing units?
Second question was about gang congregation or just?
Yeah. My understanding, you open up talking about how you're being very intentional about making sure that young people from the same gang members are not kind of clustered together, it seems, and trying to really focus on searchers and contraband and potential weapons. Can you talk about how's that going, and also provide update on, I know attendance seems to be going up?
Sure. All right. So I'll before I turn it over to Ms. Torres to talk about the school attendance, I'll address your question. So initially, there was obviously going to be some resistance to the rebalancing of these housing units. So we did see, and I think we saw that in March, a significant spike in violence with that population. We redoubled our efforts regarding tactical search operations, facility search operations, increasing staffing in young adult housing units, while at the same time providing credible messengers, other programmatic service to this population. So it's not just a one solution to address this issue. And I think what we have seen is significant calm in RNDC when we compared the metrics of April versus March. We had a 45% decrease in slashings and stabbings in RNDC alone. I would tell you that one stabbing and slashing is one too many, but I think that welcoming significant decrease of 45% is a very, very good trend. That trend was so impactful that it actually impacted department-wide. And what we saw department-wide was a decrease in slashings and stabbings of 35%. So it's still early. It's only been about 3 weeks going into our redoubling efforts regarding our security strategy. What we are looking at now is figuring out how do we maintain sustainable stability in that. And I think that's going to be really our programmatic solution and how our credible message engage with our population, our faith-based leaders and volunteers engage with that population, as well as our other programmatic strategies. So I'll turn it over to Deputy Commissioner Torres to talk about the schoolhouses and school attendance.
Good morning, Board Member Franco, as well as all of the other board members and the public. Thank you so much for your question. As we had shared in previous hearings, as well as during meetings and tours, our department has committed and developed 5 specific housing areas dedicated to school. Those are young adults whose primary goal are similar, and that is school attendance. The school attendance continues to be consistent. We average between 30 to 40 students. We're running with the partnership and support of East River Academy 2 dedicated intervals, 1 in the morning and 1 in the afternoon. And now I'll give you the better news, Board Member Franco. You know that for many years as a department, we have tried to get the GED to be computerized. And with the support of Commissioner Molina, it is something that we have already accomplished at RNDC and Rosie's. We're in fact using this week to tweak very minor issues in terms of IT. And so our IT and the DOEs are in constant communication. So that is something that we wanted to share with the board this morning. And so I thank you for that question. What we envision is once we take care of those IT challenges, probably by mid-May, we will have our first kids taking the computerized GED on site, which you know too well that compared to the paper GED administration, any kids who takes a GED via paper doesn't get results between 6 to 8 weeks. Computerizing the GED will give them results in matters of minutes. The kids will know what their outcomes are. They will know whether they passed the entire test, whether they didn't pass a specific section, and they will have to prepare with the DOE. And so we're very pleased that we have that. So that's number 1. Number 2, as it relates to educational services, as soon as the commissioner got here, he made it very clear to us that he wanted us to go forward with our desire to put the kids on uniforms and different uniforms for different activities. What we did about 2 months ago was that, you know, it's fine for us to select a uniform, but we really wanted to know what the kids' ideas for uniforms were. And so we engaged them in very specific sessions, focus sessions. I'm glad to report to you that on the 16th, we're having the company come in to show us some of the models because the kids are very picky about their pants. They want very different pants, and we want to take a look and also share those pants with them. And so that's item number 2. We are committed to incentivizing not only the schoolhouses, but the entire building as well. And I think that that is as much as I can share with you for now.
Thank you, Commissioner Torres and Commissioner Molina. And those are great news. You know, last week, Dr. Cohen and I had a chance to go and visit the Rikers. And we actually spent some time at the Young Adult Structurally Restrictive Unit at NIC. I think there were units 3B and 3C. There's about 20 young people there at any one time. And Commissioner Molina, it seems such a drastic reality for those young people to what are you actually beginning to achieve at RNDC. We met with 2 or 3 of them. It was almost impossible to talk to them through like plexiglass and the bars, really dark, musty, no air circulation, and no education at all. Torres and Molina, could you talk a little bit more about what is happening with these young people who are at NIC 3B and 3C? And do they get any kind of education, tablets, educational material, outdoor, recreation, anything? I mean, it felt like they were completely isolated from any of these new good things that you guys are being able to implement on RNDC.
Sure. Educational services at NIC are afforded through the use of tablets. The concern that you're bringing to my attention, it is something that I would like to follow up and provide a more thorough report. But the DOE, when it comes to services there, the kids are supposed to have access to the tablets. And all of the material is uploaded by one of their instructors, and follow-ups are supposed to be conducted directly by them.
Yeah, Torres, it seems like definitely no stimulation, no encouragement of any sort. I'm not clear why they end in that unit. Most of them are not clear how they get out of the unit. I remember you talking to me a while back about the reviews every 21 days. It really felt like a place where no one is going to grow and get better. And I know, Molina, you have seen the space. I know it's unacceptable to you. I wonder how long are we going to be using that space for anyone, and particularly young adults who could be in a better place.
Good morning. With regards to the young adult that's on those tiers at NIC, those young adults are there based on their involvement in very violent acts, whether it be against other persons in custody and staff for security concerns. However, those persons on those units are entitled to all of the same programs and services as persons in general populations. With regards to them participating in programming and with the counselors do request discontinuation of those persons in custody from the unit after a 21-day review. And if the team approves of the persons being removed and reintegrated into general population, that is done. Myself, I am the one that actually authorized the removal after the review by the counseling services recommendations. But they are entitled to all the services and programs as persons are afforded in general population.
Yeah, Pauline, it would be great if you could visit, because I think you will agree with me that that's not the kind of place we want anyone to be at. And it's definitely kind of goes against about everything that you're trying to achieve on RNDC.
Yes, so on July 1st, when we commenced with our RMAS, those persons that's on those units will be reevaluated for being housed in RMAS units.
So by July 1st, there may not be no one there anymore, no more young people or anyone else in that place? Is that what you're saying by July 1st?
Yes.
Okay.
Bobby, thank you, Felipe.
I just think, Chief Dukes, that to call that unit general population, as you do, is a misuse of the term general population. They are stuck in there. It is dark. They do not get out of their cells. They don't interact with other people. It's as harsh as we saw. It's as harsh as the commissioner saw when he first came. And you called units like West Facility general population. You call NIC that third floor general population, but it is not. Could you tell us how often people get recreation? When we were there, no one was out. How often people are taken out of their cells for programs?
With regards to recreation, persons on those units are afforded 1 hour recreation outside. With regards to them being on the tier, as we have mentioned, not the ideal setup. However, those persons have 14 hours out of cell time where they have access to TV, telephones, and they do have the ability to communicate with the persons who are in the adjacent cells next to them who are outside of their cells in the day room areas during general lockout times.
Chief, I understand that they are afforded everything. You say that they have total general population. They can do everything that anybody else can do, but do they do that? I mean, do they go to recreation?
Yes.
What percentage do you have the numbers on that?
I don't have the numbers on the percentage of people that participate daily, but they do participate in recreation.
If you could let us know how often they go, I would really appreciate it. The men that we spoke to described that the fact that they never went out of their cells, and so maybe if you could clarify that discrepancy. Thank you.
Thank you, Bobby.
I'm Joe Ramos. Ms. Torres, I have a question for you. Can you elaborate a little bit about your Future Now program at Rikers?
Hi, Mr. Ramos, Board Member Ramos. Can you define what you mean by Future Now? Only because there is an outside provider that is known as Future Now. We have multiple community-based organizations that come in, whether they are contracted through a major contract between the DOC as well as a contract with MACHE, as well as some of our purchase orders.
Well, the reason I'm asking that question is that I'm an old timer and an alumni of Bronx Community College, and I had the privilege of meeting a young lady who approached me and said, "Mr. Ramos, are you affiliated with Rikers Island or the Department of Correction?" And I said, "Yes, I am." "And what's the question?" She says, "Well, I am excited because I go to Rikers Island to see how I can get the young people interested in not only working with the GED, but also applying for college." So I said, "Oh, really?" So I said, "I need to speak to you a lot more because that's something that I'm interested in, because of the fact is that I remember that when I used to be at the Department of Correction, the first thing that I visited, because I worked with youth all my life, we're in and out of the systems. I visited the school and I had a complete changeover of the school with the Board of Education because I had an in with the chancellor. And I got rid of a lot of the people that used to come to Rikers Island to work, but they only used to read the newspaper while our kids were running all over the place. And we started some programs, and finally some of the youth began to get some education, as they should, and they're entitled to. But the thing is, and I always believe that the most oftentimes when young people are busy doing something, I get them tired out and they have less time to think about hurting each other. But at the same time, they take pride in learning something so that when they get out, I don't want them back in Rikers Island. So that the fact was that when they mentioned that program, and it's in conjunction in working with Bronx Community College, I said, well, I need to talk to you a lot more. But being that you're the education person and you just gave a report in terms of what's going on, I was wondering if you could elaborate on that particular program, because I'm excited about it, if it's going on.
So Mr. Ramos, Future Now has yet to return to the island. I will be more than happy to have a sit down with you and share with you which of our organizations are or have a footprint on Rikers Island. That is from Manhattan College all the way to Columbia University. Just last week, the commissioner and I had a very nice conversation with John Jay, because John Jay plans to return to Rikers Island. And so I'll be more than happy to have a follow-up conversation with you. In essence, here is my message. Anyone who wants to come in to provide services, not just for the young adult population, but as the population of the adults as well, can always reach out to me directly, and we will bring them in. Whether it's Future Now, whether it's Getting Out, Staying Out, whether it's Youth Justice Network, anyone else that wants to come in, we are open for business. Business being done differently, prioritizing the needs of our population, and especially what it is for them to leave Rikers Island and having a partner waiting for them for reintegration.
That's good. I'm excited.
All right, let's do it.
We're going to be meeting soon.
All right, sir, not a problem.
Thank you.
Thank you, Joe. Any other questions? Well, thank you. Thank you, Commissioner. I thank you, BOC. I want to turn it
We
over
have
to.
one more. I'm sorry, Julio. We have
Yeah,
one more
yes,
question.
just a quick question.
I'm sorry, Jackie, I didn't see.
No worries. Just a quick question I directed towards Deputy Commissioner Torres. Is it possible for us to get a list of the organizations that are supplying us with credible messengers?
Absolutely. I will make sure that after the meeting, we forward the documentation to our internal contact for the Board of Correction, and you can certainly have access to that list, ma'am.
Okay, thank you very much.
Sure thing.
Thank you, Jackie. And Jackie.
Thank you,
Jackie,
Mr. Chair. Thank you very much. And good morning. And thank you, Commissioner, for your focus and your leadership and commitment. I very much look forward to continuing to work with you and your team and other crucial stakeholders in order to implement change that creates a safe environment for people who live on Rikers, who work there, and those who visit. As you know, the Board of Correction has a responsibility to investigate circumstances surrounding deaths of people detained in city jails. Unlike other reviews of fatalities, ours is not focused on criminal wrongdoing or fault. Rather, our investigations are with an eye to identifying lessons that can be learned from tragedy to prevent future deaths. And yesterday, the board issued a report that was entitled February and March 2022 Deaths in DOC Custody, Report and Recommendations. And in a few moments, I'm going to turn it over to Amanda to further detail the findings and recommendations of that report. But first, in introducing the report, we owe thanks to all of the board staff whose hard work made this report possible. Specifically, Melissa Cintron Hernandez, Razim Gray, and Imani Jeffries. Thank you. And thanks as well to my fellow board members, to Chair Medina, to Bobby Cohen, and to Steve Safier for their work on the committee reviewing fatalities, and to other board members for their review and very thoughtful feedback on drafts of the report and recommendations and their commitment to improving conditions in the jails. Also like to extend thanks to our colleagues at the department and CHS for thoughtful discussion and for sharing your insights as we worked on this report. My deep condolences to the families and loved ones of the men whose deaths are reported. Any death in custody is a tragedy. We cannot change the past, but our hope is that we can take lessons from these three tragedies to help prevent future tragedies. And I should mention, in addition to the report that was published yesterday, the Special Investigations Committee is reviewing the 16 fatalities in custody, in DOC custody, that occurred in 2021. And we do expect to publish a review of those as well in the coming weeks and months as our investigations unfold. So I am going to very briefly note the men whose deaths were examined in the report. They were Tars Youngblood, who was 38 years old and was the first reported death in custody in 2022. He passed away on February 27th, 2022. George Pagan was 48 years old and passed away on March 17th, which was 9 days after he arrived at the Eric M. Taylor Center. And finally, Herman Diaz, who was 52 years old, who was pronounced dead in EMTC's clinic on March 18th. I should also note that the board has begun its review of the fatality that just occurred of Desean Carter. And with that, I am going to turn it over to Amanda, who will provide an overview of the key findings of the BOC's report and salient recommendations.
Thank you, Jackie. Can everyone hear me?
Yes.
Great. So the idea for this part of the agenda is, we know you've had the report for only a week or so, but we wanted to highlight some key points in the hopes of having some discussion today of the problems that we identified and the solutions that we proposed. Obviously, we won't go through the whole thing here. And this is to highlight some key findings. So one of the findings was that there were B posts that were unstaffed in Mr. Pagan's and Mr. Diaz's units on the dates of their medical emergencies. In Mr. Pagan's case, the B post was unstaffed until 2:30 p.m. Even after their arrival, the B post officer remained inside the A station, not on the housing unit floor. In Mr. Diaz's case, the A officer was classified as MMR3, meaning they could not have contact with people in custody, despite the fact the officers were trained, or hopefully were trained in CPR and first aid. In all three instances described in the report, people in custody were the first to render aid to the best of their ability and notify officers of what was happening, maintaining, and as we stated in the report, maintaining housing areas open without floor officers or without sufficient rounding and supervision of people in custody is a dangerous practice. Specifically, the medically monitored returned category 3, MMR3, which I just mentioned. Both Mr. Youngblood's and Mr. Diaz's housing units were staffed with MMR3 restricted A post officers. And this was critical in Mr. Diaz's case, as there was no B post officer present and the A post officer was restricted from interacting with people in custody. And because of that situation, there appeared to be no staff who were assigned, who were there, who could provide first aid to Mr. Diaz. And with regard to some of those findings, the solutions that the report discusses include, given the current staffing crisis and the lack of B post officers in many of the facilities that we've seen, DOC should revise Operations Order number 5-17, the emergency healthcare log, to clarify the CPR and first aid responsibilities of the A officer when there is no B officer. Another point is that given that B posts are consistently unstaffed, officers assigned to the A station need to be available to provide persons in custody emergency aid And the MMR3 officers don't seem to be able to provide that critical function as in those aid stations. DOC's operations order on the utilization of MMR personnel was last revised, to our knowledge, August 15th, 1988. And based on what we know, that there's a pretty high prevalence now of MMR3 restricted officers, and we're going through this staffing crisis. The policy should be reviewed and revised to reflect current staffing practices and needs. To highlight just a few of the other recommendations in the report, some more key points. The board suggests that DOC should transition out of the practice of keeping paper logbooks and develop an electronic log system. The electronic system should capture information triggered at the individual cell level. Until such a system is implemented, tour commanders should articulate an action plan to regularly audit logbooks against the Genetec video footage and watch the tour data at unpredicted times to ensure that rounds are taking place as required and to detect any incorrect entries in the logbooks. This recommendation was also included in the board's June 23rd, 2020 report on the death of Ms. Polanco. Another point that the report makes is that CHS, DOC, and BOC together should hold timely death review conferences after each death to discuss the circumstances around each death, what operational or clinical problems can be identified, and how both agencies can work collaboratively to prevent further incidents. The BOC believes that this must include the exchange of clinical information. Death is always a clinical event, and it cannot be adequately understood without clinical information being provided to DOC. Legal issues, which we understand exist, legal issues regarding confidentiality and protected health information, PHI, should be resolved in such a way that only the necessary reviewers have access to that kind of data and information, and a confidentiality agreement of some kind between the agencies protects that information. Another point that the report makes is that in the absence of placing medically fragile people in housing areas that have direct nursing and medical observation, such as the North Infirmary Command, NYC, the CDU, or Bellevue Hospital, CHS and DOC should explore expanding the clinical observation spaces that are currently available on Rikers Island. And a final point that we'll mention here in the hopes of generating some discussion is that the BOC recommends that new admissions with serious medical problems, including patients who are being treated with medication for alcohol and drug withdrawal, should be housed in medically supervised areas. And we wanted to give both agencies an opportunity to respond here to any of those findings or recommendations. And perhaps we'll turn to CHS first, since we haven't heard from CHS yet in this meeting, unless DOC would rather respond first. CHS?
Sure, I can. Thanks. I'll try. Just of the three recommendations that you highlighted, certainly two of them mention CHS, and appreciate the board's report and review of these deaths. And I just want to reiterate CHS's commitment to work with the department and the board to make the jails a safer environment and to protect our patients and our patients' well-being. The question about death reviews, as noted in our response to you, and thank you for appending that. Back in 2016, when Correctional Health Services became part of Health and Hospitals, I created something called the JAR, the Joint Assessment and Review Process, whereby the department and CHS independently timely review its own procedures, and then we get together and jointly review for systemic issues that can be corrected, whether they're procedural, protocol, environmental, or operational, that can minimize the likelihood of a recurrence of an incident like this, not necessarily a death, but any really significant untoward and negative outcome. We continue to do that. The JARs have identified over the course of the years, in many cases that we've reviewed, a number of operational and policy changes that have been put in place that both agencies identified. And we believe that it's a productive and constructive process. It respects the relevant expertise of both agencies and exponentially increases our effectiveness by coming together and bringing that information together and working together to identify solutions and actually implement them and follow up with them. We do participate, obviously, in death review meetings. It's an unfortunate name, but that's what they're called by the board when the board calls them. And I will just reiterate that we have attended each one when the board calls them, and we'll continue to do that. And you know, when you call them and convene them, we will be there. You know, in terms of expanding therapeutic spaces, you know, I think certainly the board and the department are aware that Correctional Health Services, since we came over to Health and Hospitals, been looking for ways to expand our footprint, the footprint of therapeutic housing areas. We know how efficacious they can be. We know that a therapeutic environment, even while it is in a correctional setting, is more protective of our patients, and have enjoyed the partnership of the department, both in mission, goal, and implementing the expansion to the extent that the facilities on Rikers permit this. There's no question about what the state of those facilities are and the limitations of them. With the department, we have significantly expanded since coming over to Health and Hospitals, you know, quadrupling the number of therapeutic housing areas, expanding them from just mental health to include medical and substance use areas, and other populations who are just vulnerable and more vulnerable to the deleterious impact of incarceration. I think the board also knows that we are launching really what is a pioneering project of learning from our in-jail therapeutic units to actually site them in the community in some of our sister facilities within Health and Hospitals. We're called, you know, it's not an elegant term, but they're the outposted therapeutic housing units. And the first of which at Bellevue is scheduled to open in spring of this coming year. We're really excited about that. That will significantly improve access and quality of care to some of our more vulnerable patients. We continue to work with the department within the limitations of the facilities on Rikers. Really appreciate that. These are facility and operational issues that are really the time limiting steps on these. And I think that's about it. I'll stop and hand it over to the commissioner.
Good morning. And I want to thank the board for its report and its recommendations. And I look forward to having not only continued conversations, but look forward to your support and really coming together in partnership to come up with really systemic solutions, what have been longstanding issues. Just to talk about just three things that I think are important briefly is one unstaffed post is one post too many that's unstaffed. And I can share with you, just looking from a historical perspective, going back to September of 2021, on average, this department had 110 posts that were unstaffed. And what I will tell you is in April, that number of average posts that are unstaffed has dropped down to 13. Like I said, one is too many. 13 is too many, but we have made some significant strides in addressing housing floor officers that are on staff. As it relates to electronic logbook, we are evaluating and looking at a number of technology solutions that not only will address electronic logbook system, but other issues in how we manage our schedule and deploy our staff. So we're working on things like that now, specific to electronic logbook. It's been, from my experience, that's connected more to a jail management system, which we are also evaluating. That's going to be a big upgrade for us when we're able to do that. And happy to share with the board as we get closer to thinking about what type of solutions we might have technologically in the future to deal with having an electronic logbook. And as it relates to strengthening our ability to really create an operational ecosystem that's in synergy with CHS, I think what we, CHS has been a good partner with us. And I think a lot of what you're describing in your recommendations, I think has to really also be spelled out through the MOU that our department has with CHS. I look forward to having more conversations with CHS regarding our MOU to make sure that our expectations of what we want of our operations does everything to strive for the best healthcare that we can provide for the people that are in our custody.
Thank you for those comments. And I'm sorry to break the flow for a moment, but the public advocate has a tight schedule today and has asked for a few moments to speak. And I believe Denise has that ready. He'll speak for only a few minutes, and then we can get back to our discussion. And thank you for joining us.
Can everybody hear me?
Yes.
Oh, thank you so much. I appreciate getting the opportunity now. I know there's important business to be done. Thank you, Commissioner and the entire board. I really appreciate the focus today. If you can give me 1 second, something happened. Can you hear me now?
Yes.
Okay, thank you so much. I just want to briefly say a few words. As mentioned, my name is Jamani Williams, Public Advocate of the City of New York. I thank the Board of Correction for allowing me to speak today. Once again, thank you, Commissioner, and the entire board. Obviously, we know these are critical times for those on Rikers Island. The violence and dysfunction is so high there that federal receivership is now an option on the table. With a 3-week notice, the Department of Correction must present an action plan to a federal court by May 17th. Otherwise, we may see a federal takeover at Rikers. It is disappointing that years and years of mismanagement has led to this moment. We had an opportunity as a city for months, years, maybe decades, to do the right thing and offer a plan for those incarcerated and staff on the island. It's clear that we failed. The conditions at Rikers Island are truly inhumane. People lack life-saving medication, miss crucial medical appointments, live in unsanitary conditions, and are given spoiled food. The ongoing issue of correctional officers reporting out sick is causing an increase of stress and work for staff who are in place at Rikers. With the combination of the already dehumanizing environment and the COVID-19 pandemic, these exacerbated the living conditions and working conditions and increased the violence over the past couple of years. Inevitably, this meant that the number of deaths have also increased. Last year, 16 people died at Rikers Island, which is known to be the highest number of deaths since 2016. As for this year, there have already been 4 deaths that have occurred. We've heard the latest death of 25-year-old Desean Carter, who committed suicide in his cell. It's tragic. At the same time, the number of self-harm cases have risen. During the pandemic, these numbers surged. Towards the end of March 2020, there were 52 self-harm incidents per 1,000 people in jails, and this number rose to 88 in 2021. We know the names and stories of those who we've lost. The city has failed them and their families. We cannot continue to allow this to happen and witness numerous families grieving over their loved ones that took their lives while jailed and awaiting trial. As I mentioned in previous testimony, the city has failed those who also work on Rikers Island. Many correctional officers are obligated to work double, triple, or even quadruple shifts to staff shortage. According to a report published by the 13th Nunez Monitor, they found that about 19.31% of the total number of uniformed staff were sick leave as of January 26, 2022. Some officers have mentioned being sexually harassed, assaulted, and abused during the job. In March, a correctional officer was slashed across the face while breaking up a fight, nearly losing their eye. These horrible working conditions also impact those who are under the staff supervision. This could mean that medical appointments for incarceration people are disregarded or missed, continuing the perpetual cycle of their health and medical concerns being ignored and neglected. For far too long, the old policies and terrible management has been detrimental to incarcerated people and corrections officers and staff who work there. For fiscal year 2023, the administration plans to hire an additional 598 correctional officers. We should be concerned about hiring more correctional officers when there are other officers for the city who are not coming to work and is already on the budget. The message from this administration should be preventative, not punitive. We have other staff that we can hire as well, including social workers, other type of interrupters, and people who are credible messengers as well, as I heard folks speaking about. Hiring more officers while officers are out sick may send the wrong message, not only to the city, but to people who are currently coming to work. These new correctional officers would be hired by the city's risk management accountability system. I was encouraged by the comments made at March 23rd City Council hearings that RMAS would focus on low census and high staff ratio. Staff may include health and mental health professionals. At the same time, I'm concerned about the use of RMAS. As of last week, the number of people on Rikers Island is at least 5,400. Alarmingly, the number of people detained in pretrial detention is increasing. On May 11, 2021, it was 4148. As of May 6, 2022, it was 4609. As mentioned, DOC continues to have correctional officers who are out sick for an indefinite period of time. We don't know what is the procedure when the ratio cannot be achieved. That remains unclear. I actually think the public would be surprised to know that there are actually increased number of folks on Rikers Island right now. We cannot wait to see what happens with DOC's plans. Punitive segregation, commonly going back and forth with punitive and solitary. We know it still exists on Rikers Island. We know the names of people who died while in or after being in solitary. Lillian Polanco, Khalif Browder, Brandon Rodriguez. These are too many deaths for an abusive, inhumane, and immoral system. As elected officials, we must remain committed to seeing transformative change to Rikers Island. There's still an opportunity for us to lead. We must be able to separate for safety. We need to separate for safety. At the same time, isolation is a danger, and we need to focus on reducing threats without using isolation. DOC's clinical alternative to punitive segregation used for incarcerated individuals with serious mental illness is an example of using mental health staff that aims to reduce any potential harm, being able to separate without isolate, and stepping down back to population. My office will soon present legislation in the City Council on solitary confinement. The bill would end solitary/punitive segregation as we know it. It also centers the lives and the experiences of those who are incarcerated. Solitary is disproportionately used against people of more color. It is also worse for people with pre-existing mental illness, as well as increasing the risk of self-harm and suicide. The rate of suicide was 5 times higher for those in solitary in New York State from 2015 to 2019. I'm excited to see this legislation introduced in the City Council and anticipate its pass based on the urgency of the moment. Federal receivership should not mean the city should stop us from working together to figure out what is needed. We are elected officials. We are the board. We are expected to implement changes that are needed for everyone in New York City, including those individuals who are Rikers. I hope that when the bill is presented to City Council and the Board of Correction provides its support, as the foundation of it is based on BOC rules. We should take federal receivership as a serious action on the table. It should push us to take this as a final critical moment for change. It should not be viewed as continuing to do the same things before. We know that failed, and we can't continue to do the same thing if nothing at all. I thank the board for allowing me to speak. I always want to make sure I'm speaking up for those who are housed there and those who are working there. Many folks who are working those triples, quadruples while people are home. We want to make sure that we're bringing folks back in. It's hard to explain the increase in the budget while folks are home and sick leave. But I know that this commissioner, this board didn't necessarily create the mess, but we're here. We've had some months to try to address it, and I'm hoping we in the next 3 weeks we can present a real plan, because I think receivership is not something most of us want, but it's on the table. We have to do something. My office is willing to do what we can to be productive in getting us to a place where everybody is safe and feels safe. I do understand some of the concerns of corrections officers as well, not feeling safe in that environment. We have to do everything that we can. Thank you again. I appreciate the interruption to be able to say a few words today.
Thank you. Thank you very much.
So turning back to the discussion of the report that was made public yesterday and the points and potential solutions that we had outlined. We've heard from CHS and DOC a little bit. Do any of the board members have questions or comments?
I just have a question for the commissioner. And I also want to make a statement with regards to the new recruits. I think that people should understand out in the community that the addition of the 598 correction officers that were being afforded to the Department of Correction are people who are needed, that were never replaced in the last couple of years. That's not in addition to the number of people that we have there. The other thing is that what I'm concerned about is the ratio between correction officers and a supervising captain. When you have a ratio of 5 to 1, then they can do their job the way they're supposed to do it. When if you have a captain who's responsible for 10 or 11 correction officers, that's difficult for a captain to supervise all of those individuals. So that we need to look at that. But the other thing is that and I know that the Department of Correction is going to have a hard time, recruiting new correction officers because of the negative publicity that the Daily News and all those papers who are anti-uniform putting out in the community. So as a result, it's not going to be easy for them to be able to replace a lot of those correction officers on a specific time. I know because I was a head of correction recruitment, and I developed a recruitment unit in the New York City Department of Correction. Matter of fact, we had to turn people down when we were doing recruiting at that time. Now, the other thing is that we talk about there was a lot of publicity with regards to these last, which I personally feel they were natural deaths in this last year, 3 months. But there was no negative publicity about those 16 homicides I'm sorry, not homicides, but suicides that were committed last year. So but the other thing is that leads me to ask the commissioner that to add in his statistics, how many lives have been able to save in terms of suicide prevention? I think it's important because the correction officer is never given credit for saving lives also. So I think, and I'm talking about past experience. I'm not just doing it because of the fact is, but I'm passionate about the Department of Correction because I've never left it. I've always continued to follow it. And I'm passionate about those that are detained. That's another thing. They continue to address the people that are in the Department of Correction as prisoners. Those are detainees, okay? And from there, they go to the state. But while we have them, they're detainees. And they continue to address the correction officer as guards. They're not guards, they're correction officers. So I think we have to look at some of those things to eliminate those stereotypes that are occurring in the city of New York. And it's because of the negative publicity that we have been getting there. And negative publicity on the Department of Correction, it's negative publicity on the correction board as well. And that's how I look at it. So, the fact is that, when I see young people coming out of our system and then going and doing well for themselves, educating, because we all make mistakes in our growing process. And it's our duty to help them, not rehabilitate, but to educate them so that they don't come back into our system. But at the same time, we also have to protect the correction officer and work very closely with them and support them. So that's my statement. And I'm sorry that I deviated a little bit from the norm, but I think it's important, Commissioner, that we also have a little box there of those numbers of people that we have been able to save from getting rid of themselves out of society. That's all.
Thank you, Board Member Ramos, for your statement and your question. And I think that just to give a broad stroke answer to a lot of what you said is the reason why this department has developed a management analysis and planning unit. That unit did not exist. And I think a lot of what you're talking about, not only defining metrics and outcomes to see what works, whether it's related to specifically the uniform operations, healthcare, delivery of programmatic services and their effectiveness, is why my team came together to say we need an Office of Management Analysis and Planning so that we can capture a lot of what you're talking about. Not only can we capture and see improvement, we can be evidence-based in our operational decision-making so that we can always find a way to be a learning organization and improve our practices, whether it's determining the right number of first-line supervisor to correction officer ratios, program evaluation effectiveness, all of that we're building out. And what we're talking about is real systemic solutions that have not existed to address a lot of the systemic failures that have gone on here for over a decade. So I look forward to working with the board as we develop that out, sharing solutions that we come up with, but more importantly, sharing with the board and the public the results of those metrics and being very transparent as to our operational capabilities and our outcomes.
Thank you.
I just wanted to add to the commissioner that we, on the staff level, would look forward to meeting with and developing strong relationship with your new deputy commissioner to handle management analysis and planning as they build out that new unit.
Say that again?
Absolutely.
Bobby?
Can't hear him.
As the commissioner recognized, there are many of the points raised in this report are valid, and he said he will work to improve them. These were not natural deaths. They took place in housing areas which did not have any officers present. There was great failures in getting emergency care to people. This is the jails cannot work without the capacity of having functioning emergency care. Serious medications necessary for potentially life-threatening situations were not provided to men who needed them because there were no officers to bring them to the medication. Critical evaluations of sick people, certainly one sick person in this case, did not occur because the correction staff were not available to bring this person to the clinic for observation. I think we have a lot to learn from this, particularly to question the capacity of the department, not its intention, and not to disagree with the decades of mismanagement that the monitor's report mentions and demonstrates every 6 months, very softly and now a little louder. But this situation is really different. When medical staff cannot get their patients that they know are require evaluation to see them, and they tell the department that they need to see the person, and nothing happens, and they don't expect anything to happen. That is a very, very serious situation. When officers are not present and people in custody are free to roam their housing areas because they can get out into the corridors, as happens regularly right now on Rikers Island. This is not part of our report, although it was part of the report in terms of getting people to clinics. This is not okay, and I don't understand, Commissioner, and I hope I'm wrong, how you are going to provide the necessary numbers of officers to staff all the B posts, to have people who can provide support in an emergency setting from the A post, and can bring persons to their necessary clinical care. The mayor signed an executive order within the past 5 days saying that they can't do that, and this report shows that they can't do that. So I hope that what you have in place for the judge is something that we can all believe in, and that can be funded and can work. But at the present time, and this is just a week away, at the present time, I am very concerned with the department's ability to perform its fundamental function, which is to provide the care, custody, and control of the persons it is responsible for. And right now, our report demonstrated that this doesn't happen. Right, and the department does not have the capacity to do that right now. And I hope that you have a plan that will answer all these questions in the next week. But the situation should not be downplayed at all right now. And there was another death of someone, we don't have our report yet, but someone who was in a psychiatric hospital for 7 months and then comes to Rikers Island and is dead in 2 days from apparent suicide. Something is very, very seriously wrong, and it's not your fault. And it is, and I believe that you are doing all that you can to improve it, but it's dangerous and it's deadly right now. Thank you.
Freya had her hand up, and then Jackie Sherman.
Yeah, thank you. So I had a question about one of the situations and the facts described in one of the deaths of Mr. Diaz, and in that case, it was found in the board report that there was no B officer and the A officer was medically modified, so that meaning that the officer couldn't interact with people in custody, and therefore there was no intervention as Mr. Diaz was choking, and wanted to understand if it was what policies kind of contributed to that situation, if any, and whether it was that the officer isn't allowed to leave the A station inside the bubble, or was it the MMR status? And so the fact that the only officer in the facility was MMR modified, or was this, or was it in fact within policy that the officer should have left the station and gone to intervene in that situation? So understanding that it's still going to be under investigation, I would at least like to know what the policies in place are regarding, in an emergency, can an MMR modified restricted duty officer physically intervene to help save a life? And additionally, if there is only one officer in the housing unit and that officer is in the A station, can they exit to intervene in a life-saving situation?
Thank you for your question. As it relates to the A post officer, whether the A post officer was MMR or full duty, that officer should not be leaving that A station for any reason. Now, in this instance, the A station officer did trigger a medical emergency. The reason why that A station cannot be compromised is because it can lead to other security failures within a housing unit. I completely understand that people would think that in that type of a situation, the A station officer should be coming out to render aid, but it can lead to other security situations that can place not only that officer at risk, but other persons in the housing unit at risk.
And can you walk us through, you said that you've gotten it down to 13 unstaffed posts. I assume that's per day. I don't know if that's per tour or per day. It's a small number, but which is good. But the fact that it is a small number also would make it seem that in an environment where you have thousands of officers, that it is solvable, perhaps with transfers between facilities. And can you explain why we continue to have 13 unstaffed posts when that is a relatively small number compared to the size of the department? And also, operationally, what happens when a warden what process does a warden follow when they have an unstaffed post in the facility? What's the immediate escalation protocol to ensure that that post gets filled?
Thank you for your question. So yes, while the number 13 is significantly lower than the 110 unstaffed posts we had back in September of 2021, it's still 13 unstaffed posts too many. So I will have the chief sort of walk through what happens when a post is recognized as being unstaffed and what that process we go through to redeploy additional staff to cover that post so that we limit its unstaffing situation as much as possible. Chief.
Thank you. Good morning. What happens when a staff is posted unstaffed? Correction. The facility warden will make notification to our Emergency Operations Center, which has been operating since December of 2021 on a 24-hour basis. Once that post is identified by the warden, the staff assigned to EOC utilize the staff who are on daily redeployment and dispatch them to the actual facility. We have a transportation system set up, whereas the officer is transported to the facility and delivered to the front gate and confirmed with the on-duty tour commander, who is the assistant deputy warden. Times when we are notified, it may take a shorter time to get the person to a post, leaving a post unsupervised for a time other than immediate response. But we make all efforts to get the person, once we have been notified at the EOC, to the facility quickly.
Just wanted to make one small point, and sorry for this, but we have requested some data about that exchange between the warden and EOC, and both the facility level, what are the requests, what housing areas are getting hit this way, what types of housing areas, is it MO, is it GP, is it and also the data on what the EOC is actually able to accomplish and what the wardens actually receive. And we were told that data exists and could be pulled, both the input and the output, but we haven't received it yet. And we'd very much like to understand that more and receive that data.
Thank you, Amanda. We'll have further discussions on that issue.
I'll just wrap up this set of questions and say I think it's good you have a system in place. I would just urge the department to look at why it didn't work in this situation, why there would continue to be any gap at all. It seems like if an officer is coming coming off the end of a double shift, that could or should be a trigger to make sure that there is some sort of contingency in place for ensuring that the post is scheduled, is staffed. Given the long hours everyone's working, it seems like most of this is pretty foreseeable in these individual cases. So whether it's an analysis and a kind of deep dive into what exactly was done with the staffing scenario here, or a more systemic review, it's good that the Emergency Operations Center is there, but it's a question of whether it's kind of functioning tightly enough or able to solve for every case.
I think I'm gonna ask a question following up on the exchange between Freya and the commissioner regarding the A post, and completely understanding why it would be crucial for an A post officer not to leave their post. Obviously, that underscores the importance of having the B post officer on the floor to be able to respond. I think it also highlights in this situation, particularly in Diaz, but elsewhere as well. Commissioner, you mentioned that the A post officer here did what they were able to do from their post in triggering an emergency. And the report identified a discrepancy there and elsewhere, sort of along similar lines, in the department's understanding and documentation of when emergency calls were made, whether emergency calls were made, and CHS's receipt of those emergencies and response time to them. And also particularly from my individual position as a lawyer, I can certainly understand the need to negotiate MOUs and to ensure that there is a common understanding on both ends of roles and responsibilities. I guess I would also ask what changes are in the works given the situations pointed out in these reports and others to ensure that there is a clear system, clearly defined roles and responsibilities in calling in an emergency and responding to it where there is urgent emergency medical assistance required on the floor. And what steps are being taken now to follow up on the situations pointed out in this report?
So thank you for that. Obviously we're digesting your recommendations. There are some things that you've identified in this report, which we have also identified. The investigation specific to the deaths that occurred are still ongoing. So there's more information that I think will be revealed that I would think help advance improving our communication strategies as far as activating medical alarms. But I can assure you that I'm working with myself and the executive uniform operations team to address these gaps that have existed for a long time.
Thank you, Commissioner, and I look forward, and I'm sure the rest of the board looks forward to hearing additional detail about the specifics as your work continues on this.
Thank you, Jackie. Any other questions? If not, I'm going to move to one of our final sections with slashings and stabbings and other violent issues. And I hate to add gloom to already dark situation, but hopefully, this can just help us really begin to look at what are some of those things that we can do more effectively. And again, the key word that I'm hearing is collaboration. And Commissioner Molina, thank you for your initial report, because I think you outlined some of this initially and how some of this has gone down over the last month. So currently slashings and stabbings are happening in our jails at an alarming rate. There were 148 in the first 3 months of the year. In April, there were 43. It is a promising dip, but still an alarming number of people to be stabbed and slashed while detained in our jails. Over a 10-year period, the number of reported slashings and stabbings has increased by 1,097%. From 35 slashings and stabbings in 2011 to 419 in 2021. During that same period, the average annual census decreased by 57%, from 12,419 in 2011 to 5,563 in 2021. In the 12-month period beginning April 1, 2021 and ending March 31, 2022, the monthly average rate of slashings and stabbings was 0.76, so per 100 people in custody. Prior to that, the highest rate DOC staff could find in the records dating back to 1990, when the average monthly rate was not quite that high. The monthly rate of slashings and stabbing incidents has increased 673% from 2016 to 2022. That is the period of time the newness monitor has been in place. We are concerned about these numbers and the people who receive serious injuries and often indelible facial scars during their time in our jails. We want to set up a regular meeting with the commissioner to discuss these issues and work on solutions together. Hopefully, Commissioner, you will welcome that opportunity, and I'll open this up for questions and comments.
May I just say something that may answer some questions that may come later? And yes, of course, Chairman, I always look forward to opportunities to engage either with members of the board individually or as a group to discuss a number of issues, slashings and stabbings and other violence included. It's widely known that violence rates at RNDC, where a majority of our young people are housed, are consistently the highest in the department. This is not a trend that is unique to the New York City jail system. Young adults who are classified under the Board of Correction minimum standards as being age 18 through 21 have age-specific development considerations, risks, and needs. They must be treated as a unique population, both in how we manage their responses to conflict and potential for violence, and in how we approach programs and services. In order to address rates of violence, we are rebalancing, as I've shared with the board previously, housing areas to ensure that no gang has an advantage over DOC staff or other incarcerated individuals. We did anticipate some amount of resistance among the population as the young adults are being rehoused. This resistance, however, is a natural part of change, and we have put measures in place to provide enhanced support for both our staff and the young people as they go through this transition. To eliminate or at minimum greatly reduce serious violent incidences and injuries, we've stepped up our search operations to reduce contraband in these housing areas and throughout the facility that may lead to serious violent incidents and injuries. Prior to any housing movements, sweeps are now being conducted to ensure that any ailing infrastructure items are removed so that weapons cannot be created. The plan also includes increases to the staffing levels in these units to both limit the potential for violence and respond quickly and appropriately if violence does occur. That staff will be closely supervised by facility leadership. Failures of duty will not be tolerated. Staff have been provided with clear expectations that will be upheld through their guidance from facility leadership and when necessary, corrective or disciplinary intervention. The shift towards best correctional practices in housing policy and approved supervision are critical tools to reducing violence. I recognize that the sustained change also requires institutional programs and policies to engage the population towards positive pro-social behaviors. As we have mentioned in recent board meetings and at city council hearings, we are bringing incredible messengers and staff who are trained to meaningfully work with this population to disrupt existing patterns of violence. It's not just about security work, it's also about social work, it's also about educational opportunities. We've also expanded our partnership with faith-based organizations to help young people foster a deeper connection to their faith and their values. These providers, coupled with our DOC program counselors, have received training in restorative justice, behavioral therapy, relationship building, and more, and will further support our young adults as they unlearn violent responses to conflict and stabilize in our new housing model. And I think that we've seen really good early metrics that support that we're doing is working, and we have to find a way to continue to sustain that. As I said earlier, our slashing and stabbings in April compared to March of this year have dropped 45%. That drop has also impacted the department entirely to a reduction in slashing and stabbings in April compared to March to 35% decrease. In addition to that, when we do a look back at April of 2022 and we compare April of 2021, that decrease of slashing and stabbings has been 25%. That, with the uptick of those in our custody taking opportunity to have education or corrective training, career technical education increases, is a whole holistic solution to bringing order to RNDC so that the young men that are in our custody can create opportunities to really change the trajectory of their lives.
Thank you, Commissioner.
I wanted to point out something to the commissioner, which I hope you'll appreciate, and that is that this board was briefed prior to this meeting about a particularly horrible incident that happened before your time in December that involved many weapons and a loss of control of some housing areas. And what we've learned from our staff is about the prevalence of weapons that are crafted from plexi, or what appears to be plexi. And I wonder if you could address, I mean, that's not the only type of weapon that's being made from the dilapidated facilities, but if you could address whether those are detectable by the mag or whatever you are using that might only detect metal. And what are you doing to help reduce the prevalence of these weapons that are fashioned from plexi, given that there's so much plexi in the system right now?
Thank you for your question, and I'll have the chief talk about security detection of plexiglass and other ceramic weapons. But as you know, the RNDC has been undergoing a huge project to replace hundreds of doors that were inoperable at that facility for many, many years. And by the mid or end of summer, we should have 500 operating new doors at that facility alone. But it's not just about doors. What you'll notice as you tour many of our housing units is we have large windows of plexiglass that for years have been broken. That plexi that's broken has been used to fashion weapons. And what we've done is, working with our facilities maintenance teams, we came up with a solution to put up perforated metal, a mesh. And I think maybe one or two of the board members might have seen this during their tour, where it still allows for natural light to come into an individual cell unit, because I think that that's important. It still allows for that person to have control over fresh air coming into their unit, but does prevent a person from breaking that plexi and creating a weapon and causing harm. But I think a lot of this is about best correctional practices and about prevention, where we can come up with infrastructure solutions to solve many of these issues. Chief, I'll have you talk about just the detection of that plexi once it's broken.
Yes, good morning. With regards to the plexiglass, our metal detectors that are in our facilities does not detect the plexi, as it is not metal. However, as we have testified with regards to removal and recovery of contraband, we have increased our special search operations, which is done by our emergency service units and our special search teams. That is just not dedicated to RNDC, but all our departmental facilities. In addition, we utilize other security devices that assist us and support our contraband recovery with the utilization of our body scanners when persons are suspected of having contraband on their person in places that is just not visible to the natural eye. We increase producing these persons to intake areas for a body scan search. And whereas we've had great success with contraband recovery utilizing those methods.
And let me add, I was there visiting Rikers, and I did see that Commissioner Molina, I believe DC Torres, and Ali, I don't know her title, but Ali helped. I saw the screens over the plexiglass. I definitely thought it was an excellent idea. So yes, thank you for that. Any other questions, concerns? Amanda, I'll bring it to you.
Just want to make sure that there are no other comments or questions from board members. I thought I saw someone lean in.
Are we going to hear from RMA about RMAS?
Bobby, do you have additional questions about?
No, but it looks like we had skipped RMAS on the agenda, so I just wanted to raise that.
We did discuss it in the beginning, but I'm not sure I heard whether the commissioner still feels confident that he can make all of the changes by July 1.
I didn't think we had a full discussion, so.
Yes, to answer Dr. Cohen's question, I'm still committed to operationalizing RMAS on July 1. I'll ask our Assistant Commissioner Kaiser to sort of update the board on where we're at with RMAS. Commissioner Kaiser.
Yeah, thank you. Good morning, board. Thank you, Bobby, for the question. Please provide an update on the department's progress implementing RMAS by July 1st, as the commissioner mentioned. As a brief update and overview for the new members, RMAS, the Risk Management Accountability System, is a novel approach to behavior management that seeks to address underlying causes of violence or violent behavior through programs and intervention in lieu of more traditional discipline, while importantly separating individuals who commit violence or violent acts from the general population. As a further breakdown of how this will look in the department's facilities, we are planning 7 level 1 units, which will include 10 hours of out of cell time for individuals who commit grade 1 violent infractions while in custody. Those units will be capped at 12 individuals per unit. As far as level 2 units, we are currently still planning for 6 level 2 units, which will provide 12 hours of out of cell time for individuals who are found guilty of grade 1 nonviolent or grade 2 infractions, as well as the RRUs, which will serve as a step down unit for individuals who complete levels 1 and 2 or level 2 in RMAS. And RRUs will be specialized general population areas offering 14 hours of out of cell time. All of these units will include, as was mentioned by the chair earlier in the meeting, an open day room area with congregate tables and settings for individuals in these units. They will also include video conference capabilities for court and attorney teleconferences, as well as televisit cells for family televisits. They will also include law libraries with electronic research and typing equipment, separate counseling rooms and congregate program space, as well as air conditioning. As we have submitted several months ago at this point, there are policies that were completed that will guide operations in these units, and construction in these units are underway. All of the designs the department submitted to the SEOC were approved and were subsequently submitted to the board. We remain on track to complete 13 units by July 1st, with the remaining 4 units completed by August 1st. We are in the process currently of relocating the PACE units in GRVC to the other side of the building, which will allow us to locate the RMAS units on the odd side of the building in one specific area to better manage that operation. And we are currently planning to complete our first RMAS or RRU units in the next 2 weeks. And we're additionally starting work in additional units this week as well. With regards to training, we remain on track with our staff training. We've been steadily training approximately 30 to 40 staff per week. To date, 406 staff, which includes 353 uniform and 53 non-uniform staff, have completed the multidisciplinary phase 1 training. An additional 72 staff, including 44 uniform and 28 non-uniform, have completed a partial phase 1 training, so they have a day or two to complete. As a reminder, the phase 1 is the mandated training and includes an overview of the RMAS system, an overview of the programs offered in RMAS, a more detailed dive into the RMAS policy and procedures, as well as an overview of procedural and restorative justice principles, conflict resolution, and crisis intervention, as well as specific targeted training on working with young adults, the due process procedures, as well as mental health awareness. Since the last board meeting, we additionally started phase 2 trainings. Again, these are supplementary trainings. These are not required by the BOC rule, but they cover additional security and operational areas, including scenario-based trainings. Thus far, 13 staff have completed the phase 2 training. 2 additional staff have completed partial trainings, and we'll continue to roll the phase 2 training out even after July 1st. As far as communications, we've developed a communications plan. We've been rolling out DOC TV slides, as well as a newsletter and an FAQ for our staff. And we're currently working on plans for communicating these changes to the population, which would supplement changes to the rule book and the handbook, which are forthcoming as well. And before I turn it over to Deputy General Counsel Melissa Guillaume for some further updates, just a brief update on the de-escalation rollout. Since the last meeting, we've rolled out 2 additional de-escalation units as we communicated to the board, 1 in AMKC and 1 in BCBC, and we remain on track to implement all of the de-escalation units by July 1st as well. We've also instituted an internal audit process where we're reviewing de-escalation placements to ensure compliance with the policy, and we'll make any operational changes as determined necessary. At this point, I'll turn it over to Deputy General Counsel Guillaume. Thank you.
Good morning. Just to inform the board that the department has come into compliance with the HALT Act requirements that went into effect on April 1st of this year. The department is relying on our enhanced supervision housing model in order to house individuals who have recently committed either a violent act or have been found in possession of a scalpel or other dangerous weapon, or have a history of serious violence from the general population, in order to maintain safety and security amongst the individuals in GP housing. In terms of the due process that is required under HALT, under the HALT, it basically indicates that correctional facilities have to provide incarcerated individuals with access to legal representation when they're going to be confined in under confinement. And confinement is defined as an individual receiving less than 7 hours of out of cell time. And currently the department does not operate such housing. So therefore we do not provide legal representation. That will be done once we are fully implementing RMAS on July 1st, as has been stated by the commissioner and AC Kaiser. What we are currently doing is we have transferred our separation status from GRVC to NIC. So individuals are able to use the individualized day room areas for their 14 hours out of cell, and then be able to interact between the individualized day rooms with other individuals who are in that housing unit. And we will continue to notify the board of any placements in and out of separation status. Thank you.
Bobby?
Yeah, I have a few questions. Thank you very much for that explanation. Is there a scanner being used in the intake facility in the MTC?
Good morning again, Bobby. There is a body scanner at the Eric M. Taylor Center, and it is utilized as per our agreement after the person has been seen in by medical. As we all know, that is our new admission hub facility. persons are subjected to the body scanner.
Oh, okay. Thank you. I appreciate that. You know, Commissioner, you were. I'm still very excited about your plans for RMAS. It is a breath of fresh air, and I wish you all the best with it. And obviously, you're spending tremendous effort in terms of staff training and staff time, executive staff time to make it right. I raised the issue of NIC again. You eloquently described it as I can't remember your exact words, but you didn't think that people should live there, I thought. And you were going to close it down, and it was not. So I have two questions. When is that going to continue through July 1st? Because I don't even know if it meets HALT. I assume you say it does, because you said that you meet HALT right now, but it's being there the other day did not strike me as a day room situation. It struck me as a cage. And the other issue is you mentioned that you're using ESH instead of PS, right? Because of HALT. Are you shackling anybody in ESH at this time? Those are the two questions.
Dr. Cohen, thank you for your question. So you're right. On July 1, when we institute RMAS, we'll be moving away from NIC, possibly using it only in separation status situations. And we're trying to be really thoughtful of how we could even improve that situation as well. To your question regarding the use of restraint desks in ESH level 1, we are currently still using restraint desks in ESH level 1, but we'll be discontinuing that practice on July 1 when RMAS is fully operational.
Thank you.
Sorry, did you have another question?
No.
I wanted to echo what Bobby said about being really excited about this plan, and just commend the department, commissioner, and all the staff working to implement it, to keeping it as a top priority as you face so many other challenges. It's a very solid plan. And the only concern that I have in kind of putting together all the different pieces of this meeting is, the fact that it is so reliant on staff to implement, and given all of the out of cell time in congregate spaces that there will be. So and it sounds like training of staff is on track, and that's great. But what have you put in place to ensure, or will you put in place to ensure, that there is full staffing consistently of these units, steady staff and kind of completeness of staff, to ensure that you will be able to abide by the policies you're setting forth regarding out of cell time?
Thank you for the question. I think one is, we're not going to be scaling up every housing unit simultaneously on day one, right? So I'm not going to, on July 1st, put all of these individuals in RMAS. We will still have people that are going to be in general population. In addition to this training, there are incentives that we're trying to develop and finalize for the staff that's going to be working in RMAS with this population. It's not only about the security staff, but I think it's also about the programming staff, right? So making sure that we have social workers assigned there. And as you pointed out, with the 10 hours of out of cell time, and really no obligation for those that are incarcerated to participate in any of the programming, this congregate setting of interaction, not only with members that are incarcerated with each other, but in their interaction freely with staff that's there, both uniform and non-uniform staff, is going to be critical. I have some experience with running these types of housing units. When I was in Westchester, we had the Resolve to Stop the Violence program, while the individuals were not in that program specific to having committed a violent act within the facility. They were there because they had committed some very, very violent crimes in the community, and their behavior to respond to conflict was one that was very violent. And in those housing units, we had individuals out of cell time in upwards of 10 hours at a time. So our training is speaking to that issue. We're engaged with our uniformed workforce every day, not only from my office. We have peer-to-peer engagement. We're coming up with an organizational health strategy to get as many staff back to work as possible. I do want to say that we have seen a significant number of staff come back. We're not where we need to be, but this is an ongoing engagement to deal with this issue, not only as it relates to operationalizing RMAS, but also in to address a whole host of issues that we've talked about today.
I did have one follow-up question about the ESH units where you mentioned that people are getting at least 7 hours out of cell. Are there any units currently where you're not able to do the out of cell time, either because of lack of staff or the configuration of the area or the training needs of the staff?
No, there isn't.
So it looks as though, unless there are more questions on this topic, we could move to our final topic, which is the EEOs and staffing. Unless another board member has something else on this. Okay. Well, I'll be brief in introducing this topic. I know it's been a long meeting so far, and we have addressed the issue of the EEOs at each of the 3 previous meetings that I've attended. I will reiterate for the new folks or for folks who haven't been watching the emergency executive orders that emerged during the last administration, during the de Blasio administration. There are 3 emergency executive orders that were issued in the fall because of the staffing crisis and the inability to comply with certain of our minimum standards that are promulgated by the board to ensure that people have access to the bare minimum they need for a humane experience in the jails. They are EEO 241, EEO 279, and EEO 297. They were, I'll just go through them really briefly. 241 was initially issued on September 15th of 2021 during the prior administration, and it declared a state of emergency within the correction facilities that DOC operates due to excessive staff absenteeism and staffing shortages. It, among other things, directed NYPD to take on some responsibility for court operations involved with the handling of people who are in custody in the court system so that more of your folks could be working in the jails. It suspended Board of Correction minimum standards related to commingling of populations of people in custody, so that rather than mandating that young adults were separated, it allowed DOC discretion to consider what safe housing for them might be. It also suspended the BOC minimum standard related to ESH, the enhanced supervision housing, only so far as to allow DOC to put young adults in ESH, which would otherwise be prohibited by our are rules that were promulgated in 2015 and which the department had been complying with for years. And it also said that respecting only the housing area 2B in GRVC, that certain minimum standards would be suspended to permit DOC to use that area for special safety and security purposes. That one was amended by EEO 66 this year on March 29th, 2022, to refer to NIC instead of GRVC because the housing area was moved. So the next EEO from the prior administration is EEO 279. It was issued November 1st, 2021. It suspended many of the minimum standards that go back to the 1970s, including standards around involuntary lock-ins, law library operation and access. And it also upended the newly promulgated RMAS regulations that we've been talking about in this meeting. And it suspended restrictive housing standards that related to pre-hearing detention, punitive segregation, case management upon replacement into restrictive housing, due process, and procedural justice requirements for disciplinary proceedings in the RRUs, and certain restrictions that we had put in place on the use of restraints. The third emergency executive order that was issued in the prior administration was 297, not to be confused with 279. But 297 was issued November 23rd, 2022. And this one had to be done because when the RMAS rules were suspended, the issue of whether our old rules would remain in place hadn't been addressed. So what 297 did was make it clear that while the RMAS rules that were supposed to go into effect last fall are suspended, the ESH and punitive seg rules that were promulgated in 2015 will continue to be in effect, which means that currently the department should be complying with all of the board's rules with regard to ESH housing, with the exception of what I mentioned earlier about the young adults. And 297 provided that DOC could continue placing young adults into ESH. And the Board of Correction went on record when these were first promulgated by the de Blasio administration with a statement that is still on our website, where our former chair objected to them as an imposition and a danger to the independent authority of the Board of Correction. I believe the board is still basically of that opinion and very concerned about the persistence of these EEOs. The practice prior to the imposing of these emergency orders was that when the department was experiencing a difficulty, or when CHS was experiencing a difficulty which would render it temporarily unable to comply with a minimum standard, we would go into an emergency sort of status where we could grant a variance to the department only for the period of time necessary to get back into compliance and with certain conditions attached. Those are all gone while we have these EEOs in place. And we've tried to begin discussions at the prior 3 board meetings this year about when these EEOs might end. And we've also tried to have offline discussions with the department about that, particularly in that there's a certain opaqueness to the staffing emergency for us, because certain data, granular data that we've been requesting hasn't been given to us, which makes it hard for us to see the precise nature of the staffing difficulties, which populations are most affected, how it impacts each of our minimum standards, et cetera, and makes it very hard for us to understand when the emergency will end and if it will end. So there was one more EEO 7 that was in this administration, but it was issued on January 9th, 2022, and it only suspended a minimum standard, a new one that related to the creation of de-escalation units. That one we're also concerned about, but we're getting reports from you that you're actually creating the de-escalation units. In which case it just begs the question, why do we need that EEO if you're actually able to do it? But I want to open the floor up after that brief background to board members and to the commissioner to comment on or have a discussion about the future plan for the EEOs and whether they will continue to be reissued by this mayor every 5 days, as they have been, or whether there's a plan to end the EEOs.
I think the question should be directed to the commissioner at this point, and we could respond to.
Sure.
So thank you for that. At this point in time, an emergency executive order is in place where the department works towards implementation of RMAS, which we've had several conversations about this morning. Additionally, an emergency executive order is in place to reinstate the rules for ESH and PSEG until RMAS is implemented. There is also an EEO in place which delays implementation of the de-escalation units. As the board is aware, the department is committed to a July 1 implementation date for RMAS and de-escalation. Therefore, from my vantage point, after July 1, these EEOs will no longer be necessary. In the meantime, the department has been keeping the board informed of all progress made towards implementation of RMAS and the elimination of other forms of restrictive housing. Additionally, the department has in good faith implemented, as you stated, our de-escalation housing as we scale that up to all of our facilities. The next public meeting where the board would have an opportunity to vote on variances is June 10th. And at that point in time, the department will be continuing operating under the EEO until July 1st. I'll pass it over to Deputy General Counsel Guillon in case she has anything else to add as it relates to the EEOs. No.
That was everything.
Okay.
So, Commissioner, thank you for your comments. Am I understanding correctly that you're having an executive order because you cannot comply with RMAS, and when you can comply with RMAS, you won't have an executive order? It doesn't have to do with all the other reasons that your and the mayor's executive order describes as to what you're unable to perform in the jails right now: law library, recreation, medical access to medical care.
So Bobby, thank you. I think, a lot of this is interconnected. I mean, I think at first, a lot of it that was driven by the Omicron surge. We had to get back to a state of where we can train our staff up to deal with RMAS. We're also managing the increase of the population at the same time. So I think it's not just about RMAS. We're on a state of getting to a point of stabilization. And the goal of that is July 1st for the implementation of RMAS and de-escalation. So I think it's a whole host of factors. And that EEO is in place to allow us to have the flexibility operationally to make sure that we're not in violation of the rules in our current state.
So you think that there is a current emergency situation in the department where you are unable to meet certain minimum standards, including RMAS, law library, and lock in and lock out, and therefore you are not asking for it. The emergency is so intense that you are not asking for variances. You've decided to throw the board overboard for the current period.
I wouldn't describe it in that context. I think the intensity of where we were at the peak of all this has come down significantly. But I think as we've opened up a lot of things that did not exist prior to me coming here, like family visitation, moving 5 out of 8 facilities from 12-hour tours to 8-hour tours, significantly decreasing on-staff posts, the EEOs give this department the flexibility that it needs to be responding in an environment that is really unique, given the drivers of a lot of things coming from not only mismanagement, but a global pandemic that reshaped the criminal justice system in the city.
I understand why you get that. Of course, it gives you more flexibility to not have the board standards be your guide. I look forward to the day that you'll stop using EEOs for flexibility and meet the minimum standards that the board has developed over the past many years. Thank you. I do one more question. In the NIC, the units that Felipe and I went to with Melissa, we were told that those people are sentenced. And I did not understand, you have a general population unit where people are sentenced?
Good morning again, Bobby. With regards to persons being housed at NIC, we have no units dedicated to persons being sentenced at NIC. So the conversation may have been maybe a person on the unit may have been sentenced to state time, but we have no units at NIC dedicated to.
No, I'm sorry. They were sentenced to serve a restrictive housing sentence because of an infraction. That's why they were there. We were told, and they were told, and there's a policy that there would be a 21-day sentence for the infraction, and that it could be continued. Usually, it would be continued if there were another infraction. And we had the sense, I had the sense that at the close to that infractions continued to occur in that unit, understandably, and the sentences were extended. I didn't think, is that something that you're able to do because of the no board standards, or are you? I mean, you remember that, I don't know, you weren't there, but ESH 1 for young adults was closed down because the department could not be in compliance with it, and you set up this place, which you call general population, for the people, young adults, who you would otherwise have had an ESH 1. But I do not understand that how a general population unit, which has full access to lockout and all programs as you described, are actually people who are sentenced to this unit because of an infraction.
Go ahead.
I am not aware of a particular case, Bobby, but if you all could share with me that person in that incident, we would gladly look into it and investigate it.
Yeah. I think, Chief, Dr. Cohen is actually alluding to something that we saw, Commissioner Torres, that young people are not clear why they are in the unit. I mean, even though they know they have actually done something wrong before, and definitely they don't know how they're going to get out of the unit and what do they need to do to work to do so. So I know the department has struggled in engaging young people in programs before. It's hard to engage them when they don't even know what is expected of them. So Torres, I mean, I saw your counselors working really hard at engaging young people. I'm not clear if the young people who are in NIC understand what they need to work on. How is that reflected in the 21-day reviews? And how can they actually get back to regular population?
Well, as I mentioned before, I will personally look into this. Our counseling team, as well as any of the division's members who go into that area, do provide guided conversations and goals to the young adult population. I will look into it and provide a response through our own internal channels.
Thank you.
Thank you.
Sure, are there other comments? Amanda?
It looks like we're ready to turn to our public comment period then.
Wonderful. Just want to thank the commissioner, the OC team, for all that you're doing to try to turn this around. We are your partners here at BOC, CHS. We appreciate all that you're doing. Grateful for this opportunity and looking forward to next steps and really seeing violence and deaths decrease. And you have our full support to make this happen. So thank you all for this opportunity.
Thank you, Chairman, and thank you to the board members.
Thank you.
We'll move to the public comment section at this point. So we would like to encourage all stakeholders, friends, and family members of people in custody, staff, and the advocates, and the public to contact the board with their concerns for individual people in custody. Our oversight is strongest when we all are working together. Our staff is here to help. We will now turn to hear the public comment. So I have a list of speakers who signed up to speak. I'm going to call each person's name. When you hear your name, please raise your hand using the hand icon below the participants list on your WebEx screen. If you don't see the participants list, click on the silhouette of a person on the menu at the bottom of your screen. Once you open the participants list, you should see the hand icon to raise your hand. Once you raise your hand, we will unmute you and you will be able to turn on your video. You can then begin your public comment. I will tell you when it has been 5 minutes and we will move to the next speaker. Please try to adhere to our 5-minute standard. The board also welcomes written comments. You can email written comments to Amanda. Or mail them to 2 Lafayette Street, 12th floor, room 1221, New York, New York, 10007. I will now call on.
I'm sorry, I just wanted to interrupt to say that the email address is boc@boc.nyc.gov, although I would love to hear from people too.
Thank you, Amanda. So we'd like to begin this section with Council Member Carolina Rivera. Gracias.
I'm trying to reach Councilwoman Rivera. If we can go to Daniel.
Sure. Daniel.
And Daniel, you can please unmute yourself.
Are you asking about Danielle Girard?
Yes.
Okay, thank you. I wasn't sure. My name is Danielle Girard. I'm a senior staff attorney at Children's Rights, a national advocate for youth and state systems. We're also a member of the New York City Justice Coalition and the Young Adult Task Force and advocate for young adults incarcerated on Rikers Island. I'm not sure why the department was talking about the need for increased funding. According to a recent report by the New York City Controller, the city spends over $500,000 per year to incarcerate someone on Rikers. Let's contrast that with approximately $40,000 a year to provide someone with affordable housing. This is a colossal waste of taxpayer resources at great harm to young adults and their families. The New York Times has recently noted that Commissioner Molina feels that absenteeism is a priority, but on any given day, about a third of DOC's 7,700 uniformed staff are out sick. This behavior is directly responsible for the tragic and continuing deaths of many incarcerated persons, the burnout of staff who do show up for work, and the general dysfunction on Rikers. Until COBA gets its members to do their jobs, little is going to change. And now I'm going to repeat something you've all heard before and will continue to hear until the department is fully committed to the just care of the young adults in its custody. While incarcerated, every young adult deserves 14 hours out of cell time each and every day. Not a single one of them deserves to be shackled to a desk when out of cell. Every single one of them deserves congregate programming, including outdoor recreation and education. And every single one of them enough nutritious food so they're not hungry when they go to bed. This is all particularly important with the launch of RMAS, where the out-of-cell time is simply not sufficient. This is all particularly important as the department continues to be governed by executive order, or if we return to past practice, governed by variances from the minimum standards. Thank you for the opportunity to testify.
Thank you, Daniel. Herman Jimian?
Leo, I think I see someone named Isabel Chandler from Councilmember Rivera's office
Okay.
in the attendee group. If that is the method by which Councilmember Rivera is joining us, she could raise her hand.
Anything, Amanda?
I don't see anything, so I suppose we should proceed with the list until we hear from Denise.
Sure. Herman Jimian. Koba?
And we don't have Herman present, so we can, I also looked up Emil, who is also not present. So it looks like next is Rachel.
Wonderful. Rachel, and I won't pronounce your last name. I'm sorry.
Okay.
Schneiderman? Oh, yes.
Can you all hear me?
Yes, and see you.
Hear you, Rachel. Yep.
Good morning. My
We can
name is
see and
Rachel
hear you.
Schneider, Specialist Gender Services. I'm direct advocacy. I prepared testimony to discuss the blatant halt violations happening on a daily basis in GRC units 13A and 13B. And while those violations, including 24-hour lock-ins, increase the likelihood of self-harm and suicide attempts on Rikers, in light of Desean Carter's death, I want to talk about something that many advocates have tried to stress for almost a year. Rikers Island is completely out of control. There is no semblance of order, and a federal receivership is the only possible order without loss of life. Commissioner has been untrustworthy. Less than 2 weeks ago, on the 29th, at a city council hearing that most of today's attendees participated in, Melina program and mental health resources were widely accessible.
Rachel.
You're breaking up quite a bit, and it's hard to hear.
Should I? Okay, I'll turn off my camera. You can hear me, but so Melina has tried to stress that all of these resources are available and that detainees are trained in suicide prevention and staff can handle any situation that arises. But what we as advocates have tried to stress is the following. Number one, 24-hour lock-ins in general population houses would contribute to the rise of suicide attempts. Number two, CHS's failure to detect detainees with mental health diagnoses leading to their placement in general population DOC and CHS is ripping detainees out of mental health units abruptly and throwing them into general population without explanation would contribute to the rise of suicide attempts. Only 10 days ago, our office submitted testimony about 2 of our clients with incredibly serious diagnoses, schizophrenia and psychosis, who remained in general population despite repeated requests to have them placed in mental observation. We submitted testimony about our clients who call us begging for help after being taken off suicide watch against their wills. And we have been on the receiving end when those calls for help go ignored over and over and over again. Mr. Carter's death is a tragedy because any death in custody is a tragedy, but especially because it was preventable, because what happened to him has happened to so many. I'm not sure what our evidence monitor or boringly required to intervene, and their failure to call in a receivership is an abomination. There is blood on you.
Thank you, Rachel, I believe. Thank you for your testimony. Ms. Sharita, Freedom Agenda?
Hello, are you able to hear me?
We got you, Sharita.
Okay, thank you. Good morning. I want to thank the board for issuing a really important and illuminating report on the recent deaths in custody, and I want to urge you to go further. I want today, I'll back up to introduce myself. I'm Sarita Daftery, co-director of Freedom Agenda and a member of the Jails Action Coalition. I'm going to repeat some things we have called for repeatedly, but which are even more urgent now in light of this report. I want to urge the board to issue a call for decarceration. Your call for decarceration and reducing the jail population at the beginning of the COVID pandemic had an important impact. The threat to human life due to the dysfunction at Rikers now is at least as great or greater than it was at that time in March 2020. This is not just about officers coming back to work. And so if we think that the problem will be fixed when they do, if they do, that's incorrect. Your report showed that in the housing units where Mr. Youngblood and Mr. Pagan died, there were B officers present, but they didn't conduct rounds. As noted in Mr. Pagan's housing unit, the officer instead hung out in the bubble. And as the board and even the commissioner has acknowledged, there is no timely discipline process. So that officer and others know that they can ignore their duties without consequences, and many will continue to do so. We also urge the board to recommend consolidating operations on Rikers. DOC does not have enough control over its massive workforce to staff so many units. DOC should be closing at least one jail in the coming months. The primary reason to do this is the safety of people in custody and reducing triple tours by staff, but it's also in line with the jail population that actually has been declining since the end of February. The average daily jail population has been reduced by almost 600 people since September, when it was at 6,000 and is now down to about 5,400. Higher than it should be, but currently declining. We urge the board to call for investment in supportive housing. The mayor's plans to grow DOC's headcount by 578 officers cannot be supported, and the board should be vocal about this. The DOC does not need to replace staff who are leaving when they still have 2 times more staff per incarcerated person than they had 8 years ago. The mayor's proposal to grow the headcount by 578 officers could actually mean hiring about 2,000 officers when you account for attrition. That will cost hundreds of millions, and it's an unconscionable waste of money that could be used to meet people's needs and keep them out of jail. The commissioner himself has said there should be more investment in supportive housing, and correction officers themselves know that jails are not a suitable environment for people with mental health needs, substance addictions, and intellectual disabilities. The funds allocated for more officers should go to expanding justice-involved supportive housing units. The Corporation for Supportive Housing outlined that last year, there were over 2,500 people who cycled through Rikers Island who could have been served by supportive housing who might not be there if they had supportive housing. Many of the 20 people who lost their lives in Rikers in the past year might be here today if they had supportive housing. This is something we can do with the political courage to put the resources where they're needed. I will wrap up here and again, thank the board for your work on that report and really urge you to take the next steps needed to save lives. Thank you.
Thank you, Sarita. Next up is Natalie Forienza.
Hi, good morning. Can you all see me and hear me okay?
Yep.
Yes, okay. Good afternoon, everyone. My name is Natalie Fiorenzo. I'm special working at New County Defender Services. Our clients live under constant threat of death or serious harm while living in New York City's jails. This is a fact, and it should be more than an every day I feel like I'm scared for my life. If someone wanted to hurt me, they could because the guards are never there. The guards stay in the bubble and talk to their friends, and they never come down to the floor. Yet the commissioner, the department, and even the board have been sitting here all morning boasting about how many accomplishments this administration has made. To sit here and listen, be lied to, be misled, especially after someone just died on Saturday, is disheartening and frankly in poor taste. We still sit here waiting on staffing numbers almost halfway through 2022 at this point. The department always brings up the 1,000 officers that are back now, but even with that 1,000, Rikers is still operating with a maximum of 2/3 of their staff. Halt solitary went into effect on April 1st, but not really. One of our clients who I've been working with this past month was in ESH level 1 for 29 days. He was receiving no outdoor recreation. His out of cell time was limited to an hour, and he said that they usually came to get them after about 40 minutes, despite the mandatory 4 hours. This is an open violation of the statute. He was illegally detained in his cell for at least 23 hours per day for a month. He was excited when he told me that he was finally able to because there's more freedom there. I explained to him the time in ESH level violation of halt, and he had no idea what I was talking about. The detainees didn't even know about this new law. They know about it. These are just two examples besides the slashings and deaths in custody that were discussed all this morning that the Department of Correction is not functioning legally or effectively. City Council can see this. The jail advocates see it. Our clients are living it. And the Monitor is reporting on it. Their most recent report said point blank, we are issuing this special report to advise the court and the parties of the continued imminent risk of harm to incarcerated individuals and staff in the New York City jails. DOC is the only one who's telling a different story. They are not able to manage Rikers Island. Our clients desperately need Rikers to be put under a federal receivership. Thank you.
Thank you, Natalie. Jack Hills.
Okay, good morning. I'm an intern with the Urban Justice Center, and the following is the testimony from an individual incarcerated in the North Infirmary Command on the topic of insufficient mental health treatment in the NIC. I'm 58 years old and incarcerated in the North Infirmary Command on Rikers Island. I've been here for almost a year this time, but I've spent many years of my life in and out of Rikers and State Prison. I was born and raised in New York City. I grew up in the Lower East Side, Harlem, and the Bronx. As a kid, I spent a lot of time at the boys' club and I worked to help out my mom. I've been a mama's boy my whole life. I was also very involved with my church as a choir boy, and after high school, I joined the military. Around this time, I began my lifelong struggle with depression. My brother was killed by gang members, I lost contact with my father, and I was struggling with the emotional after effects of abuse I experienced in the church as a child. These events weighed on my mind and continue to do so. When I was arrested for the first time and sentenced to over a decade in state prison, I was treated horribly. I was segregated into protective custody for a lot of that time. I couldn't be in general population because I'd been an informant. They said they were keeping me safe, but I felt like they wanted me to suffer. I spent years in a unit with only 1 hour in the yard per day. They also often put me in the box for long stretches of time, one time for 14 months. The lights were on 24/7. The room wasn't ventilated. I wasn't allowed any personal property or visitors, and I had nothing to do but listen to my own thoughts. I felt like I was a prisoner of war, and I don't know why they would treat someone so poorly who was an informant for the government. My depression worsened, and I developed PTSD. After 8 years, I got out on parole and got into a Christian mental health program. This helped, but I still struggled, particularly after my mother passed away. I developed an alcohol addiction, which made it very hard to keep jobs. I had to turn to small scams to get by. I'd get arrested and serve a few years of time. I always got jobs in the prison library and even finished college and got certified as a paralegal while incarcerated. I would get released and try to find lawful avenues to make money, but with the overbearing pressure of my mental illness and addiction, it is a tremendous challenge to stay out of trouble. All I wanted was to get clean to break the cycle, but I've realized there's no rehabilitation in prison. It only institutionalizes you. I know if I can get clean, I can stop all of this and stay out of prison for good. I've never wanted to hurt anyone. I've had to use my addiction to cope with my depression, and everything that I've done has just landed me in prison, where I've been just trying to survive. My colleague, Linda Kate, will continue and finish the testimony.
Linda Gilbert?
Hi, can you hear me?
Yes, we can.
Great, thank you. All right. My name is Linda Gilbreth, and I'm an intern at the Urban Justice Center with my colleague Jack. For almost a year now, I have been back at Rikers in the North Infirmary Command. The conditions here have been very hard. Last time I was here, I was in therapy in the mental health office. This was very helpful as I was able to talk about the abuse I experienced as a child and the ongoing challenges it has caused me. However, this has all changed. Now, requests for mental health treatment that are supposed to have a 48-hour response time can take multiple weeks to get any response. When I do get a response, the mental health professional comes to my dorm gate with the CO to talk. I live in a dorm with about 30 people who all come up to the gate to listen, so there's absolutely no privacy at all in front of everybody else in the dorm and the CO at the gate. I cannot possibly talk about any real issues like this in front of everybody. Without access to privacy for my mental health treatment, there is no way to get better. They only take your mental health concerns seriously if you are actively suicidal. It should not have to come to that. This change happened because of the COVID pandemic, but there are no signs of the mental health office opening again. I have made many requests to continue private mental health treatment, and they continue to deny it. Everybody deserves the right to mental health care they need. If I was charged with a drug offense, maybe they would have put me in an inpatient rehab program so I could get the help that I want and need. But instead, since the crime I was convicted of is not drug-related, I'm just thrown into prison again. Yet, my mental health and drug addiction are the cause of this whole cycle. I can't get clean in prison, and therefore when I'm released, I fall back on the same patterns. And the only way that I can get out of this cycle is to get the mental health and addiction treatment that I need. Sometimes it's really hard to find a reason to keep fighting. I try to cling to the hope that I can escape this cycle. With my paralegal training and all of the law reading that I have done in the library, I know there is a real place for me out in the world. I just can't get there without the mental health treatment that I need and know I deserve. Rikers has taken so much away from me over the years, and the least they can do is give me proper treatment so that I can fight back against my demons and escape this horrible system. Thank you all for your time.
Thank you, Linda.
Before we go to the next speaker, I wanted to interject and repeat something that we've said in meetings before, and this is addressed to the entirety of the public who attend our meetings, and especially the advocates who come and speak about clients anonymously. I want to remind people that if their clients would like the help, they can come to us. We have staff out in the jails every day. We have a person out there who's wonderful, who can connect people together with the right staff, who may also be trying to take care of your client. And I think those connections can be helpful. We also take the Freedom of Information law very seriously. And if advocates send us a Freedom of Information law request about your client's conditions of confinement, we will respond appropriately under the Freedom of Information law. And I would encourage people to talk to us before please do participate in public comments, but also please do talk to us along the way as you're encountering problems. The second thing I wanted to say is new, which is we are exploring ways to allow people in custody to testify themselves at these public meetings. And I appreciate the effort that goes into preparing testimony for them and articulating it on behalf of them, but we are looking to improve in that area. That's all.
Thank you, Amanda. Veronica Villa.
Can I just start? Okay. Good morning. Welcome new members to the board. I'm Veronica Vella from the Legal Aid Society's Prisoners' Rights Project. Last September, the board issued a statement on recent suicides in the jails, in which it called on the city to move with urgency to make the jails safer and pledged that it would work with criminal justice stakeholders to expeditiously decarcerate. 10 people have died in DOC custody since then, including, as we all heard, a young man by suicide just this past weekend. And as that report and recommendation the board issued yesterday on the 3 deaths that occurred in the first 3 months of this year made clear, these deaths are not natural deaths, but instead very clearly a result of departmental failures and staff mismanagement. As the situation grows increasingly dire, the department loses its legal and moral authority to hold anyone in its custody. And we must ask, what has the board done to expeditiously decarcerate? What have you done to exercise your mandate to oversee jails that are now nationally known as human rights catastrophe? Say the names of any of the 20 people who have died in custody since Wilson Diaz Guzman died by suicide in January 2021. And we know the answer is not enough. And it's not for a lack of information. We all know what is happening in the jails. Just look at the March statistics on production of individuals to their medical appointments. Over 12,000 appointments were missed in that single month. It's been 7 months since we at the Legal Aid Society filed litigation to enforce the city's duties to provide access to medical and mental health care. The court ordered them in December to comply with these duties, but instead of acting with the urgency demanded by the situation, the department threw up its hands and proclaimed that providing access to medical care has become too hard. The department admitted in court that it is not meeting its legal and ethical duties to detain persons. And for months, it has claimed that it is on the cusp of solving this problem. In the meantime, the numbers of people who are not being taken to their medical appointments, their medications, their mental health appointments, those numbers are increasing exponentially. The board has this information. So where is the notice of violation of the minimum standards? The board has more access to the jails than any other entity in the city. You can see in real time which housing areas don't have the staff or the capability to respond to medical needs. You can literally see how the department's unwillingness or inability to get its oversized workforce to show up is having fatal results. Your May 9th report makes clear that it is unsafe right now to hold anyone in New York City jails. After the fact recommendations are not enough. You must put aside the finger pointing that happens between DOC and CHS after every report and find the department in violation of the minimum standards. You must also demand a public accounting of progress on each of your recommendations to those death reports on a weekly basis. This department must be held accountable. Thank you.
Thank you, Veronica. Chaplain Dr. V. Phillips.
Hello? Can you
We
hear
hear you,
me?
Dr. V. We can hear you.
You can hear? Wait, why my video won't start?
I can see you now.
Oh, okay. I thought y'all was trying to play with me. Peace and blessings,
We ain't gonna
everyone.
do that.
Okay, before I even start, I just really want to address something that I've heard Ms. Masters say. And I just have to address this. When we report things to BOC, we not everything is followed up on. I've reported this on the record several times, and I have actually raised concerns with the former chair about reports coming into BOC and then actually being kicked back to the grievance unit and everything else. So I would stress, if you're going to inform the people of New York City to send reports to this oversight board, that you make sure you do not put our community members' lives in jeopardy by sending it to the very people that they are seeking help against. That is very important. So now I can start my testimony, please. Peace and blessings, everyone. I am Chaplain Dr. Victoria A. Phillips, founder of Visionary V Ministries, member of the longstanding and active Jails Action Coalition, Justice for Women Task Force, and many, many others. As co-chair of the Young Adult Task Force, I felt it was important for me to remain quiet while observing DOC's admin, to be fair, as the commissioner took his new position. Can y'all hear me?
Yeah, we got you.
Because I know other people was acting up and wasn't no one telling them. Okay, so yeah. So every month I have been known to come before this board and testify. Yet for the first time in a decade, this year, I have remained quite silent. I advocated for Commissioner Molina to be given fair treatment, being that he was coming in after an advocate's favorite was removed as commissioner, and the new reckless and often quick to speak while uninformed mayor and advocate's nightmare had appointed him. I remind all that he took over the same conditions Vinny and Stanley had, yet the difference was they were supported by us advocates. I say that because the groundwork was laid and ready to be paid by the commissioner's drive and dedication to whip Rikers and the boat into shape. Yes, he eagerly met with almost everyone his first month in. The time took time to build up his team, and I must state on the record that if his immediate circle stays the same, unfortunately, I believe solid progress will always elude his vision. DOC will tell this board and city council that officers are back to work, and it's true, until you begin breaking it all down by facility and tours. There are still serious staffing concerns, shortages where programming has yet to resume or get back to a steady routine. And board member Pitts, peace and blessings and welcome. And I just want to point out to you, as a former female officer, that I still receive reports from female officers of not being able to even get a bathroom break during their tour. And I'm sure you can understand how dire that is. And rec many times is dismissed, and the answers to my question as to why has yet to change. No officer around. Units still go unwatched. Now let me quickly turn your attention to the Young Adult Task Force. And peace and blessings to new board member Ramos, and I hope that you will be joining us with board member Franco in these task force meetings soon, since you are part of the Young Adults for your entire career. And I say that because I have been a part of the advisory board since the beginning, and Judge Hamill was an active member. Even after my emergency brain surgery, I had the neuro ICU nurse call into the board meeting to let them know I wasn't taken out and would be back. And I say that because in the Brand administration, the call-in option was removed. The meetings went from weekly to bi-weekly, to monthly to quarterly. And then everyone became shocked when the then Commissioner Brand stated on the record that the young adults was her most violent population to detain. I have testified at how DOC admin have told me in advisory meetings after questioning the then DC on conditions that they would stop the meetings, but they knew I'd run the city council. Then in the summer of 2021, Commissioner Sherardi reinstated the advisory board, but made it a task force in hopes of giving us more power to implement change. I was nominated co-chair, and I felt myself quickly disappointed and unable to really implement the things that needed to be done. Once again, without teamwork, any real drafting of a plan with advocates and experts, a process began, and DOC often spoke at us instead of with us. It was obvious from the first meeting attended by this commissioner that he was not impressed and appeared bothered that DOC would be answering questions that advocates had. But he was willing to give the information. I will say that on the record. I must admit there was many questions, but to be fair, after 2.5 months of back-to-back meetings being canceled by the last administration, I can understand where the frustration came forth in the first task force meeting, which seemed like a report back rather than an actual meeting. And the last meeting he attended, I could see things were truly changing. I noticed that the very one who told me she'd end the advisory board if she didn't know that I'd run to city council began a disheartening rant on how offended she was by answering the questions and other things. It almost felt as if it was planned, with an assistant commissioner jumped in with just as much fire and added to her statements. I had to remind them both that nothing about asking numbers for level 1, which is people held in shackles, or staffing numbers of units were new. It also felt as if they was performing for the commissioner, and not to my surprise, they then canceled our meeting, which has already been rescheduled from 4/27, the day he had to speak on receivership. I'm putting this on the record because at a time when all eyes are on conditions, when a plan must take place across the board, he has chosen to once again cancel the meeting. Remember, Brand stated the young adults are the most violent. Commissioner Sherardi also restated that. Our mayor consistently speaks on our youth and raising the age, yet his chosen commissioner doesn't see the value in utilizing a task force full of juvenile and young adult experts and leadership. As co-chair, 5 months in, I can honestly say the commissioner and the DOC of programming have never met with me together regarding the direction, need, or vision for the task force. I've maintained my own rapport with uniformed staff, CHS staff, and all detained on my own. With the lack of interest to engage, knowing that the DOC suicide task force has yet to meet this year, and how I am being limited or disregarded as co-chair. In the spirit of no more Desean Carters, today I cannot believe as an Army brat, I retract my statements to other advocates and experts regarding federal receivership, and I call for the immediate help that my community members need ASAP due to the continued misguided or blatant disrespect of minimum standards in the law by DOC and CHS staff. Programs cannot be effective without a beat officer on tour, and 6.5 years ago, I actually asked City Council for more funding for officers because they was working 3 tours. I asked for expansion of the investigation unit, and I asked for more funds for programming. All have fallen short under DOC's admin. CBOs, you're not going to get away from this as well. If you have an RFP, bring your people back to Island and do the work. Because when programming is up and running and fully staffed, public safety is not an issue. And lastly, I will say this. The time is now. When City Council voted to close Rikers, I recall asking Councilmember Chin, was the height of a building worth the cost of a life? Now I ask this oversight board, how many more Mr. Carters must there be before you all start calling for at least a transition task force, or what is most needed, federal receivership with grassroots personnel directing the process? How many people died in special units last year in DOC? With 2 medical doctors on this board, I know you already know if CHS had assessed Mr. Carter for mental health. 2 days in Rikers and his distress took his life. Let me be clear on the record. Suicide in DOC custody is murder. Care, custody, and control. Receivership now or the next life is solely on all of your hands. Peace and blessings to all of you.
Thank you, Dr. B. Let's go with Michelle Feldman.
Next, we have Tahini Dunn.
Hi, can everybody hear me?
Yep.
Okay, thank you.
Welcome.
My name is Tahani Dunn. I'm the director of the Prisoners' Rights Project at the Bronx Defenders. I'm going to share the stories and experiences of our incarcerated clients, which is not what I was originally going to do, but I do feel that it's necessary as I believe that their voices need to be uplifted and credited. Incarcerated people have been sounding the alarm about the culture of violence and apathy, condition issues, staffing issues, and all the chronic, acute, and devastating consequences that they result from this agency's continued ability to enjoy and function with almost complete autonomy despite being a government agency. Witnessing death. Our client who was in the cell across from Mr. Herman Diaz's cell unfortunately witnessed his preventable death. He reported that Mr. Diaz had been choking on the floor for quite some time before correctional officers decided to check his cell, after several minutes of other incarcerated people yelling and screaming for help. The CO stood in front of Mr. Diaz's cell as he continued to choke on the floor, gesturing towards his neck. In response, other cellmates implored the officers to do something, but the COs wouldn't even open the cell door. Our client shared that the COs did not seem to know what to do and even seemed scared to take any action. He said, "These are people that New York entrusts with protecting our lives, people who are apathetic towards human suffering and lack basic training." The next section, deplorable conditions and mistreatment of the sick. Another one of our clients who has spent his entire period of incarceration at NIC due to serious health issues reported horrifying conditions at NIC. Our client shared that regular shifts are only 1/3 full, and they're sending in quote unquote good squad guards to fill the vacant shifts. This has resulted in demeaning and demoralizing treatment of some of the island's most vulnerable populations. Most concerningly, our clients reported serious health hazard conditions at NIC. Many incarcerated people who are housed at NIC live with HIV and AIDS and other communicable diseases. Our client has the job of cleaning the bathrooms and is regularly coming into contact with bodily fluids without being provided proper PPE to avoid transmission and other infections. He mentioned that some are unable to control their bowels and are defecating and urinating outside of designated toilet areas, creating worrisome and unhealthy conditions. These conditions clearly increase the risk of sickness and infection, which for people battling immune-compromised diseases can be fatal. Denial of medical care threatening permanent disability. Our client entered DOC custody after sustaining life-threatening gunshot wounds to both of his legs. He was arraigned from his hospital bed as he recovered from the first of many potential surgeries. The doctors were clear that he needed immediate and ongoing follow-up care, including surgery consultations, rehabilitation, and pain management. There was still shrapnel and a bullet lodged in one of his legs. For months, our client wallowed in pain, frequently being denied access to medical care, missing scheduled appointments, experiencing subpar care with little to no follow-up or follow-through when he did make it to the clinic. At one point, our client informed us that his cane had been confiscated by ESU officers during a dorm search. For days, he hobbled around in tremendous pain, pleading with everybody who would listen to try to get his cane back. It was not until we filed a complaint that it was given back to him. Similarly, for months, his legal team and I have advocated for him to simply get a surgery consultation that had been determined as medically necessary. We were ignored, he was ignored. 4 months later, after elevating the complaints to the ED of Health Services, who frequently responds to my emails and calls, which I appreciate, but it should not be the way in which we get things done at DOC and CHS. He finally received an appointment for surgery. It is to be determined what type of permanent damage has occurred as a result of DOC and CHS's dysfunction and passivity. Careless mistakes leading to a denial of dignity. This same client was unable to attend his mother's funeral despite a 2-week collaborative advocacy effort of his team and I, as well as his family. The reason he could not attend the funeral was because his name was misspelled in the DOC system and therefore did not match the spelling in the government documents provided to DOC at their request. In essence, our client missed his last opportunity to say goodbye to his beloved mother because of a spelling error. This information was relayed to us by our client. not DOC, which is extremely troubling since we had made ourselves available to assist DOC through this process. At any point, DOC could have reached out to me or his legal team to alert us to this issue. We could have worked together to ensure that this man got to experience a dignified farewell to the person who brought him into this world and loved him unconditionally. This was always our goal. The devastating effect that DOC's clerical error has had on our client will last a lifetime. He deserved more. His family deserved more, and certainly his late mother deserved more. Lastly, I would like to suggest to the board that the board consider allowing for public comment public comment first during these hearings. I believe the information that advocates provide and the experiences that we share from our incarcerated clients should serve as a compass for this board, contributing to more intentional and informed questioning. I also believe that DOC should be required to keep their camera on during public comment. It is extremely disheartening and offensive that at the conclusion of their presentations, they are permitted to simply turn their cameras on, and there is no way for us to ever verify as to whether they are actually present listening to the commentary from the public and from the advocates as well as the incarcerated people. Thank you so much.
Thank you. Benny Bosco?
Good afternoon. Can everybody hear me?
Hear you, Benny.
Oh, okay. My name is Benny Basio. I'm the president of the Correction Officers Benevolent Association. I'd like to welcome all the new board members to the BOC. I look forward to hoping one day we can meet all in person. When I testify at some of the city council hearings, I usually, have written testimony. I just wrote a couple of bullet points that I just like to discuss. I saw that the BOC's recommendation of having an A officer perform CPR while they are by themselves. That is a major security breach because if an officer is in the A bubble by themselves, if the incident is staged, then it could. Is my video on?
Yep.
Oh, sorry. All right, somebody told me it wasn't.
It's a little bit choppy, but we can see and hear you.
Okay. If the incident is staged, then the detainees in the housing area can take that officer hostage, take the keys, have the keys to leave the housing area. So that was something that I noticed in the report. I haven't divulged every issue of the report, but I just wanted to bring that to your attention. As it stands, no officer should be in a housing area by themselves. And we all know that we are scapegoated. Correction officers are blamed for everything that people feel is wrong with the criminal justice system. It's not fair. And I advocate for my members because we are working doubles, triples. This notion that people are out sick, feigning illness, there is a disciplinary process for that. If they are found to be feigning illness, then there's a disciplinary process for that. But the reality is that the prior administration failed to hire a single correction officer in 3 years' time. And since January 1st of 2019, we've approximately lost 3,000 correction officers due to resignations and retirements because of our horrible working conditions. It's not a correction officer's job to keep up with the infrastructure on Rikers Island. Basically, we feel that when a lot of our elected officials deemed Rikers was to be closed, they kind of turned their backs on us, and we were kind of left to rot on Rikers Island. And when you talk about people being out sick, you talk about 1,500 correction officers being assaulted in the last year. We visit officers in the hospital with major injuries, broken eye sockets, broken noses, broken arms. And those injuries, unfortunately, take time to heal. Not to mention the officers that try to come back to work, MMR status like you talk about. But MMR status doesn't allow an officer to have inmate contact because they are not physically 100% to defend themselves or to defend the incarcerated individuals. I just wanted to bring that, to everybody's attention. And I hear the advocates come on here all the time and, are against us having more staff. But you do the math. In that time frame that I described to you, only 75 officers graduated from the Correction Academy. And that's our reality. So, you know, when the inmate population dropped down to 3,900 and then rose again to 6,000, and you don't hire in that time frame, then you compile that with COVID. This is the end result of why we are in the situation that we're in. But everybody wants to talk about the numbers of staff that are out sick, but nobody wants to dive into why they are out sick. What are the injuries people are suffering? What are people that have had surgery, blown out knees? All of that is never talked about. The other issue that people don't want to talk about is technically OBCC and EMTC on Rikers Island are technically not even budgeted for. They're supposed to be closed facilities. But yet, EMTC is running as a fully operational jail that has 640 inmates. This is our reality. So what we're asking for is give us a correction officer hire correction officers that are required to man every post on Rikers Island. Stop fudging the numbers. The city has to, the prior administration fudged the numbers with the table of organization. And no disrespect to you, Freya. I've been before you. We've been in meetings together. I've voiced the concerns about staffing, about us getting assaulted. People don't want to have punitive segregation. But the reality is this. The violence has steadily risen since 2016 to present. Steadily risen every year on assaults on staff. And everybody wants to talk about, well, the small population of individuals that continuously assault and do not want to change behavior. Why aren't the advocates advocating for the inmate that is on the other side of that slashing to the face, right? Because everybody wants to come to jail to do their time and they should be afforded every program that they are entitled to get. But the reality is that we cannot afford them those programs because we don't have the staff to do it, and we did not create this mess. I know we want to get blamed for sick leave and all this other stuff, but look, the reality is when you have the reason why we have the sick leave policy that we have is because we perform a very dangerous job for this city. Very dangerous. We provide safety and security to the city of New York. And we ask that you stop scapegoating us because you have to have a constant flow of hiring. Because the other thing is that sometimes when people want to get into law enforcement jobs, they take multiple city exams. They take NYPD, they take MTA police, they take Port Authority. And if corrections calls them first, they come to corrections. And then when those exams open up, sometimes they leave. And that 3-year period decimated us. But nobody wants to talk about that. I hear people talking about a receivership. Well, guess what? A receiver comes in, is not going to wave a magic wand, and all of our problems are going to go away. Now, these unmanned areas are not going to go away. And I heard something about 13. I think as of yesterday, EMTC, as of the Midnight Tour and the 73 Tour, had 22 unmanned posts. Okay, and that was just EMTC. So I didn't even get the numbers from every facility there. But this is our reality. So advocates, I ask you, stop fighting about us getting staff because staff will try to make everybody safer. The detainees will get their programs and, you know, they won't be more aggressive towards us because they're not getting their programs. See, you know, it's like we're in this vicious cycle that nobody wants to talk about, right? You know, I listen to meeting after meeting and correction officers get demonized over and over and over again. We are 85% Black and brown law enforcement in this city. And no other city agency gets treated the way we do. All right? The detainees in our custody are 85 are mostly Black and brown as well. Is that why everybody turned their back on us? Is that why we're treated the way we do? Because everybody's lives matter. We are not opposed to reform, but reform has been very one-sided to the well-being of the incarcerated individuals, but not to the well-being of correction officers. And that has to change. And I see some new faces here. I want to thank you, Mr. Ramos, because it's been a long time coming that I actually hear somebody on the board talk very positively about correction officers. We are not guards. You're right. Thank you for acknowledging that. And like I said, I look forward to working with this Board of Corrections. I am willing to sit down with any advocate, any of the advocates, the Legal Aid Society, so we could, you really want to talk about reform, let's have meaningful conversations. But as long as they are meaningful, because the reality is that we don't live in a utopia. And you see the crime wave that is happening in New York City. So it's like you decide what you want to do, right? Either they're going to be running the streets in New York and gun violence is going to be crazy and you know, we'll be dealing with that, or we'll have an increase in the population. Listen, we don't get to decide who's in our custody, how long they're on our custody. We are not champions of mass incarceration. Come on. We live in a city that has 9 million people. We have 5,500 inmates approximately. That's not mass incarceration. And when you go to the borough-based jails and you cap out at 3,900, everybody needs to decide on what's going to happen with the overflow, because none of us have a crystal ball to know how much crime is going to be happening in New York City and whether you still want those individuals to be running in New York City. I thank you for the time. Oh, and one other thing. Tahani Dunn, by the way, Diaz's incident happened in a dorm area, not in a cell area. So we'd appreciate if you're going to tell a story about one of your clients, have them not be disingenuous with the public. All right? Like I said, I'm not opposed to working with anybody that wants to have a meaningful conversation. But like I said, we matter as well. I thank you all for your time, your consideration of the things that I've said. And listen, the board, we need help. We need your help. We come here, my board member, Saki Antoine, comes here month after month pleading about what's going on with us. We need your help. So please, help us. Help us, help the incarcerated individuals so we can make, you know, jail safer for everybody, because that's all we want. All we want is to be safe. Triple tours, double, I mean, come on. Like, when do we get our sanity? When does a quality of life for a correction officer matter to our elected officials in this city? It's time for those things to change. Thank you very much for your time.
Thank you.
Thank you.
I just wanted to interject for a moment. I may have misheard, but I did want to remind everyone who speaks at our meeting to please have respect for the others who are speaking at our meeting. And there are some phrases that might have been okay to use in polite society a few decades ago that are no longer. Thank you.
Thank you, ma'am. Zach?
Hello, everyone. I hope you can hear me okay.
Yes.
Great. Thank you very much. I'm Zachary Katz-Nelson. I'm the Executive Director of the Independent Commission on New York City Criminal Justice and Incarceration Reform. We're often known as the Littman Commission after our chair, the former Chief Judge of the State of New York, Jonathan Littman. I want to welcome Mr. Ramos and Ms. Pitts to the board. Congratulations on your appointment. I look forward to working with you to try and improve the conditions at Rikers for everybody who's there. Nothing could be more urgent. Thank you to the board for all the staff members and the board members who worked on the report about the deaths in custody. It is really just a really horrific thing to read through, frankly. The number of failures on so many levels. And we look forward to your report coming up on the death of Mr. Carter and the deaths last year. God willing, those will be the last reports like these that you have to release. But I think the reality is that given the current population, given the staffing crisis that's there at Rikers right now, we will not be able to save lives if we don't safely but quickly reduce the jail population at Rikers. This is not about opening the doors and just letting people out. This is about actually safe, smart policies, a blueprint that, for instance, we put out at the Littman Commission with our colleagues from the Center for Court Innovation last year about how to safely reduce the jail population. It's things like the almost 1,400 people who've been at Rikers for over a year waiting for a trial. Let's get them their day in court already. But the reason for this is obviously there's issues of justice, of accountability, of actually letting victims know if the right person was arrested and if they're being held accountable for the harm they created. But at the same time, it's about allowing DOC to consolidate operations to close jails down, because right now, with the number of staff that are there every day at work, it is not possible for DOC to staff all the posts and to keep people safe. It can't keep its officers safe, it can't keep civilian staff safe, and it can't keep incarcerated people safe. The only way we get forward on this is by having fewer people in jail. And as Sarita Daftaри mentioned earlier from Freedom Agenda, the board led the way at the start of COVID, calling in March 2020 for there to be fewer people in jail. And I would urge each of you individually and collectively to renew that call very publicly today. For the sake of everyone who enters the doors of Rikers, we need to safely and smartly reduce the population. And adding 500 new correction officers several months from now, when they clear the academy, if that budget is approved, that won't do the trick. That's not what is going to change the problems that we face right now. And it's going to take far too long for even those folks to come on board. If the city can even recruit 500 people. Last time I tried to recruit 400 and got 75 people who actually were going through the academy. We need to safely and smartly reduce the population. I would urge all of you, please, to call for that. Second piece of this is that the city, as CHS mentioned earlier, is building these outposted therapeutic units, beds in city hospitals, almost 400 of them, for people with serious mental or physical illnesses, people that we know should not be in the jail. And I was really struck by CHS's response to one of your recommendations in the report, where they basically said, you recommended if someone has a serious illness, they should be in a specialized unit. And CHS's responses was, the board doesn't understand, we don't have the space. There are too many sick people in the jails for us to actually treat them properly in the jail. CHS admitted that. And that makes very clear we need those hospital beds online as soon as absolutely possible. The first beds at Bellevue were supposed to come online at the end of this year. Dr. Yang earlier said that's been pushed back to the spring of 2023. The other beds are due to come online in 2023 and 2024. We'd urge you, please, to publicly call for the city to do everything it can to speed up construction of those beds, get emergency authority from the city comptroller, whatever is necessary to make sure that we can bring those beds online as soon as possible so people can get out of the jails and get the care they need. And the last thing I'd request, please, is that the spot checks that board staff did or board members did at EMTC, and this echoes what Mr. Bossio was just saying a minute ago, the number of unstaffed posts that you revealed at EMTC on a consistent basis throughout the month of April, please continue to do that. Please continue that through as many jails as absolutely possible, and please publish those numbers, ideally weekly, so we can really have a lens into what's happening in the jails, and just obviously the link that you drew between those unstaffed posts and the grave danger to everyone inside Rikers, it can't be stressed enough. So please continue to do those checks and make that public. Thanks so much for giving me this opportunity to testify.
Thanks, Zach. Next speaker is Ashaki Antoine.
Can you hear me?
Yes, we can hear you.
First, I would like to welcome Mr. Ramos and Ms. Pitts onto the board and into this discussion. Good morning. My name is Asaki Antoine, and I am the first citywide trustee of the Correctional Officers Benevolent Association. In March meeting, the BOC provided a follow-up to a few concerns forwarded by COBA. I just wanted to provide you with a follow-up regarding these concerns. COBA addressed the temperature of the housing area hot pots. Although DOC states the temperature of the hot pots were lowered, inmates are manipulating the hot pot mechanism to increase the temperature, and as a result, they continue to splash officers and other inmates with boiling water, causing injury. The security risk groups, known as SRG housing, although the DOC has started the blending of these units in RNDC, the other facilities, AMKC, OBCC, and NIC, are still overpopulated with particular sets of gangs, creating a continued hostile work environment, a security and safety issue for everyone. Inoperable cell doors. Although in RNDC cell doors were replaced, in other facilities, such as AMKC, the cell doors are inoperable, broken, and is in need of an overall plan to get those doors replaced or fixed. Mandated lock-in for all inmates is at 9 p.m. The cell doors do not work. The cell doors are not secured. So in essence, the inmates are never secured in their cells and can exit and enter their cells at their leisure. Can you imagine a correction officer, female or male, conducting a tour on the midnight, and the inmate exits the cell and drags the officer into the cell to sexually assault or physically assault them? To ensure a safe and secure environment for everyone, especially during lock-in times, the city and/or DOC must invest in an outside or inside contractor to fix the doors thoroughly, one housing area at a time. Since last month's meeting, a correctional was slashed in his face, almost losing his eye, by an inmate whose life he was trying to save. 2 more women were sexually assaulted by inmates, and countless others were sexually harassed. The inmates were rearrested. However, they were brought back into the housing area to violate and to repeat this deviant behavior for a second and sometimes third time. As the oversight entity, does that sit well with any of you on the BOC board? How are you going to address this? Inmates continue to threaten correction officers and display weapons and shanks, which are captured on Gentech video. Every inmate detained has a weapon on their person. The inmates continue to block cameras in the housing areas to commit crimes. I know most of you have observed this on Gentech video. What is your plan or recommendation to DOC to abate this issue? Why have you turned a blind eye to this serious issue and continue to play hide and seek regarding the issues that should be taken first priority? Holding inmates accountable for their assaultive actions is paramount. Every month, I provide documented evidence of what correction officers are faced with daily. It appears that disciplining of the correction officers has become the focal point for many of you. Officers are being disciplined for inmate misbehavior and violent acts. Meanwhile, the inmate who commits an infraction against an officer or nonviolent inmate while detained are faced with no discipline at all. Currently, the system in place is unfair and totally unbalanced. In closing, there are no consequences for crimes committed in jails daily. The inmates continue to commit more crimes, which leaves correction officers, civilians, and nonviolent inmates who become victims vulnerable. We need your help. Enough is enough. Everyone's life is at stake. Everyone, from the correction officer, from the inmate, to civilian staff, to physician, everyone's life is at stake. We must come together for the greater good to improve the conditions on Rikers Island. Thank you and have a blessed day.
Thank you.
Thank you. Kelly Grace Price.
Hi, good afternoon. I'm Kelly Grace Price from the Close Rosie's campaign. I'd like just to begin by saying, of course, I'll submit my written testimony. And what I'm going to say today, I wasn't planning on saying. I'm going to start with the good that I've seen in this hearing. Ms. Masters, congratulations. I really see the hard work that you're doing. I appreciate the things that you're saying in the meeting. It's very helpful to contextualize by starting off saying that 49% of all people caged on Rikers have a Brad H designation. The things you are doing do not go unmissed. Bobby, I really appreciate everything that you have done and said in this meeting. And BOC member Jackie Sherman, I appreciate your stewardship over the death committee reports. I know that you've actually read the report because you are the committee head that wrote the report. But the rest of the BOC members, excluding Bobby, I highly doubt that you've even read the report. I'm very disappointed at the lack of hard questions that came from the BOC chair, that came from the other BOC members. Dr. Safer, the only thing we heard from you today was that you were proud that you were only a little late to the meeting today. I'm so disappointed in this board already. There are 2 new BOC members, and one of them has already said something so egregious that we know it's going to be in the headlines tomorrow. No, I'm sorry, BOC member Ramos, not every death on Rikers has been a natural death. Not since former BOC member Gerard Bryant said that all rape on Rikers is an outcome of natural sexual commingling between COs and caged people, have we heard such egregious statements by a BOC member? Please, BOC members, be thoughtful before you come to these meetings. Educate yourselves. Write something down. Make a list of hard questions you want to ask. The people, the advocate community that comes to these meetings, we are smart. We've worked for Bill Gates and JP Morgan. You heard Dr. V testify about her credentials. Zachary Katz-Nelson, he's a smart lawyer. Ms. Vila from Legal Aid, there's no one smarter. We're all listening very carefully to hear some signs of hope from this board. I'm not hearing it from anyone besides 2 of you. Well, 3 if you include Amanda. We need you to live up to the responsibilities that you have taken. And if this responsibility is too big for you because the chaos in your own professional life and in your own professional organization is too great, please consider stepping aside. I urge you, come to these meetings prepared. You have embarrassed the city. We look to you. I hate to be so shrill. I'm Kelly Grace Price from Close Rosies. We have one more board meeting before RMAS is supposed to be implemented. We still haven't seen the reporting matrix that were promised to us last August regarding RMAS implementation. There's a lot of work to be done, and honestly, the prognosis does not look good. I'm Kelly Grace Price from Close Rosies. You will see my written testimony. Thank you so much.
Julio?
I think you're muted.
Oops, sorry about that. Jennifer Parrish.
And this is our last speaker, Chair.
We can see you and hear you.
Okay, great. Thank you so much. Good afternoon. My name is Jennifer Parrish. I'm the Director of Criminal Justice Advocacy at the Urban Justice Center Mental Health Project and a member of the Halt Solitary Campaign and the Jails Action Coalition. There are 3 issues I want to address. First, I want to thank this board for your report on the first 3 deaths of 2022. Last year, we called on the board to provide meaningful oversight and transparency about the state of the New York City jails instead of sitting on the sidelines during this crisis. The board's report is a significant step in that direction. It's timely, it identifies problems that are ongoing, and it makes recommendations that the agency should adopt. It also gives New Yorkers a window into what is occurring in the city jails. I hope that prosecutors and judges will read your report and understand the potential consequences of relegating someone to Department of Correction custody. That judges and DAs will recognize that the decision to incarcerate a person may in fact be a death sentence. The mayor's emergency action during this crisis should not be to suspend minimum standards, which are designed to protect people in custody, but to require immediate decarceration, especially the release from custody of all vulnerable populations in the city jails. The city clearly cannot provide the medical and mental health treatment that is needed. Second, I'm very concerned about the department's decision to move the PACE units in GRVC. The PACE units, where people with serious mental health needs receive a higher level of care, are one successful intervention that CHS and the department put in place. In fact, these units have been so beneficial that the city committed to increase the number of PACE units so that more people who need to be in these units can receive that level of care. But the PACE expansion has not happened because the department was not able to provide additional housing units where the PACE units could be located and staffed. Yet now the department is moving these critical units from the housing areas, which were selected because they have the physical layout that best facilitates a therapeutic environment, to other housing units in the building. People with the most severe mental health challenges should not be sacrificed for the sake of other priorities. I certainly understand the need to create alternatives to solitary, and I support that effort wholeheartedly. But it should not be at the expense of some of the most vulnerable people in the city jails. With all the problems in getting medical care for people in the jails, the city should not be moving backward on the services for this population. I urge the board to review the housing areas where the PACE units will be moved and report on the status of them, and identify whether the integrity of these units is being maintained under this administration. Finally, with respect to restrictive housing, the department should not be allowed to keep people in 22 to 24-hour lockdown in ESH and the NIC cells, and then tell the board that they are getting time out of cell, when the people in these units are clear that they're being locked down. Board members, city council members, and defense counsel have heard directly from people on these units. The board should not accept the department's claim that it's in compliance with the halt solitary law. The cages in NIC do not provide actual out-of-cell time. During previous meetings, Commissioner Molina personally has acknowledged that these units do not provide out-of-cell time. It's offensive for the department to claim at this meeting that they do. For those units where people are locked in more than 17 hours a day, the department should be complying with all the provisions of the HALT law, which includes not only limits on the use of segregated confinement, but also due process requirements. This board should ensure that the department is actually following the law. I urge the board to institute audits of out-of-cell time for all ESH and NIC units and report on violations of the HALT law, instead of relying on the department's disingenuous reports. Thank you.
Thank you, Jennifer. I believe that was the last of the testimony, Amanda. So this meeting is adjourned. The board's next public meeting is scheduled for June 14th at 9 a.m. We will provide meeting details on our website, and we will send an email to interested parties. Without objection, this meeting